Wednesday, May 6, 2020. Please join us on the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I would just like to begin the meeting with one very brief statement that our churches in Deschutes County have had incredible pressure not to be meeting, and now more than ever, our citizens need to have the guidance and help from people that have a calling. And I'm really hoping that our governor will open up our churches. They are essential and they need to be opened up immediately. So that was my message to the governor's office this morning when I sent her several emails from very descriptive letters from several pastors. And thank you for reading those, Governor, and I do believe that they should be opened. The original message on Thursday before Easter Sunday was that they could have drive-in services for Easter Sunday, but honestly, that is inadequate. So please read those letters and take to heart the message that we are providing from Deschutes County. Thank you.
So we're going to do opening statements. I agree with that, what you just said. I think the other thing that's interesting is the quality of emails we've gotten in the last few days has been amazing. Some of them I would like to just read at a meeting because they're so articulate about what they're facing, what the issues are in their lives, how this has affected their lives, things they need from government at all levels, from many different perspectives. It's truly been amazing. I think, and I wish there was a way we could get that to people, because some of them are just very articulate and really call out some of the needs we have. Thanks.
Yes, the hurt in our community is overwhelming, and just hoping that we can make a difference. Someone I know sent an email about their unemployment, and he was amazed that we got back to him immediately, and I'm just praying that his application has actually found someone in Salem that's going to take care of his needs. Commissioner DeBone, did you want to add anything?
Thank you for starting off with the churches today. There's a lot of passion on that. The opportunity to have folks in every other pew or every other row, a maximum number inside of an existing facility. People are willing to do what it takes to have that open, and I support that also enthusiastically. I did mention it to the governor last Friday. We were on the phone with her, a video conference, and she's getting the message. So this is going to be part of the decision space, absolutely. And also on the comments, the emails and the input we're getting, phone calls, people are willing to be prudent in the measures to be taken, businesses, whatever needs to be done. So, let's all work together and get this economy rolling again in a prudent fashion.
Thank you. We have no citizen input this morning. We do have a consent agenda.
We've had citizen input constantly for many days.
Yes. I can't keep up with this, but I love it and I appreciate it so much.
That'd be another disclaimer. If you're sending emails to us or phone calls, I think I got 135 yesterday emails, and it's really only part of our job is trying to respond to those, but it's really a challenge. And the phone, I noticed there was a big email that went out from one of our congressmen, and some of the big offices in the Portland area, they just have messages saying, due to the huge volume of emails, we may not get back to you, which is another option for us. I don't think we have that on ours, but we do get them. I know we've all probably spent hours reading them. We understand what people are saying and the challenges. So, yeah.
Wonderful. Could I have a motion?
So I'll move that we approve the consent agenda.
Is there a second?
I will second it.
Commissioner Henderson?
Yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. So we are now going to go on to action item number 1. Janice Garceau, Pacific Source, would you? Yes, good morning, Janice.
Okay, sorry, I had to unmute myself. My first item is the, sorry, I have to switch papers, the Pacific Source contract for the choice model services that are provided primarily out of our intensive adult service array. This is a pot of dollars that are really intended to promote more effective utilization of community supports in order to manage capacity in inpatient treatment facilities, and in particular in the Oregon State Hospital. The dollars that pass through to the CCO from OHA, and the contract, for several years there was no contract because there was a contract with OHA to the CCO, and they simply passed the dollars through. In the last year, they decided they really felt there should be a contract. We don't disagree. It's been under construction for some time, and is now the document that is in front of you for approval and signature.
Thank you, Janice. I did notice that it starts July 1st, 2019. Typical government, like, okay, almost a year later, we're looking at this and supposed to be signing it.
Yes, well, we started working on it before July 1st of 2019. We were working with a staff member at Pacific Source who was waiting on guidance from the Oregon Health Authority. That staff member then left the agency. It took a while to get another person assigned to the contract. So that's why it is so late, and that is why there's a lump sum payment coming to us upon execution for that first 6-month period.
Any other questions?
Could you maybe repeat again what you said? So previously, what was the agreement, or it was passed through from who to who?
There wasn't.
So the choice model funds are really related to the Oregon Performance Plan, which dates back to the legal finding a number of years ago against the Oregon State Hospital. So there were a number of efforts engaged in that were intended to really reduce the amount of time it took for people who were stabilized at the hospital to re-enter the community, or to manage people in the community so that they weren't at the state hospital. Choice model funding in particular is really to support alternative housing and other community supports for seriously mentally ill individuals. They are dollars that come from OHA to the community. They were managed through the CCO without a contract, since we're already contracted with them to provide services. And I think there was a decision that because this funding is so specific to a particular purpose, they wanted to have it contractually represented.
So there's a history of Deschutes County receiving these dollars.
Oh yes, we've received the dollars for a number
Many
of
years.
years.
Yeah, that was kind of my, just making sure I understood that. Yep.
Yeah, sorry for the long answer.
Oh, not a problem. Good history.
We like long answers.
So, so Janice, as I understand this, this is about a $900,000 contract, and it's really that it's laying out the details of what we're providing, or Pacific Source is providing for these people that are now no longer going into the state hospital. Is that kind of basically? And they wanted to define it more, give more detail about who's supposed to do what.
It's really outlining our responsibility to provide these services and invoice Pacific Source for those services. It specifically pays for, and let me pull up a different document, 3 full-time equivalents in our intensive adult service array and supports for client stabilization. So a lot of rental assistance, housing supports, and things of that nature. There are performance metrics associated, although the performance metrics are all dated to the period before the Oregon Performance Plan was, quote, completed. So I think we're still thinking through what performance should look like in future contract years.
Do you know how many people will be served by this contract over the 18 months?
I do not. I do not know offhand how many
It
people are.
it seems like that's the trade-off, is instead of doing the state hospital, we're saying that we're gonna supply the people to, do all of the things that and the resources for the rental, like you said. We're gonna house them in our communities, we're gonna provide other support services to people and so that would be the comparison, what would be the cost at the state hospital versus here.
Yeah, I mean, the intention is to offset the cost of having people housed in the state hospital, and also to make sure that we were able to comply with the Oregon Performance Plan as a state. So lots of communities have choice model funding for this purpose. I can tell you the eligible service population, but I can't tell you the exact numbers of people served.
So is the state hospital, I believe it's either a range of like $1,300 to $1,600 a day. Is that right, for a cost of having someone there?
I don't know the number offhand. It's
Okay,
possible.
I know it was a lot of money, so.
Yeah. I mean, the reality is it is more costly likely to be in the state hospital, but for people with serious and persistent mental illness who reach the level of symptoms that might require them to be hospitalized or who have been in the hospital, which is the service population under this choice model contract, those folks require significant resources even in the community. Ultimately it is likely a lower cost, but this is a population of people who really need housing supports, psychiatric supports, case management, and wraparound services. So it is likely less costly, but the real intent of this particular piece of funding is to minimize the length of time people are spending hospitalized and civilly commitment and get them stabilized and able to live and be supported in the community.
And we somehow track the success of that?
There are very specific metrics around tracking the success of that. We have to meet them at 90%. And again, I have to look at a different document to tell you those, but they are specifically around having 90% of individuals who are ready to transition out of civil commitment or the hospital will be discharged within 20 calendar days of placement on the list. So it's a very stringent requirement that we are diverting as many people as possible or transitioning people to a stepped down level of care within 20 days. And there's actually a performance payment associated with that in the contract.
Great discussion. So, yeah, I'll move chair signature of document number 2020-185, Pacific Source Choice Agreement.
I'll second.
Number 2.
What's number 2?
It's agreement number 2, according to the action item. So, yes, apparently we had another one before.
No, that's the next agenda item. There's 2 of them.
Oh, it is? Oh, sorry, it is. Excuse me.
This is number 1.
We're at 1.
I'll second the motion.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
Okay, the chair votes yes. So now, Janice, we're at number 2.
Number two is consideration of board signature on document number 2020-291. It's the Pacific Source Amendment number 2 to the contract between the CCO and the CMHP, us. We're requesting board approval and signature. And this particular amendment is really the document that captures the work that was being done on the performance metrics for the contract. So this is a annual phenomenon that often the fiscal portion of the contract is completed close to the calendar year when it's due. And then there is a group that is still working on fine-tuning the performance metrics, which are broad and apply to all of the partners in the contract. So the document that you have in front of you details the performance metrics for participating in the hospital capitation, withhold, and the surplus.
So on amendments like this, and I guess the last matter too, is our legal involved with the negotiation of the terms as well?
Legal was not directly involved in negotiation of the terms. They were, I kept legal involved in terms of being up to date on the negotiation of the actual contract terms, the original contract terms in terms of the financial arrangement. For the metrics, legal isn't directly involved, although they were involved in the financial arrangements that are tied to the metrics. So David Doyle and his new staff member, I believe her name is Amy, had a couple of meetings or emails from me last year as we were going through the negotiation process, just keeping them apprised of where we were in that negotiation and where we ultimately landed. And then they, of course, reviewed the contract and reviewed this document before it got to the board agenda.
So this is the CCO and kind of the Tri-County area also. I can see the other counties are involved with this, Crook and Jefferson, the Central Oregon community. Negotiating the performance metrics, is it kind of getting a feel for what is going to happen, or is it truly just kind of arm wrestling about what people think is appropriate? Just kind of the high level, getting to this separate contract from the, part number one. What's the difference getting to the performance metrics?
Well, the performance metrics are, in some ways, really, in terms of the service population, what really matters, right? So these dollars are intended to improve the health of the community, and the performance metrics are the way that we are going to know whether or not our efforts are actually improving the health of the community. This year, under CCO 2.0, there was even more scrutiny on making sure that there were community-wide performance metrics that included behavioral health measures, and those performance metrics show up in lots of places. So there's a larger set of community-wide QIMs, quality incentive metrics, that are part of the Oregon Health Authority's relationship with the CCO in terms of expecting the CCO to deliver on community health. We're all participants in those QIMs. And then we have specific performance metrics often in our own sort of individualized portion of the contract that represents what we have to do to get our withhold at the end of the year, and then what we have to do in collaboration with our partners to participate in the surplus. So there are many different places in the contract in which metrics are represented, but they are all focused on moving the dial on key health indicators and health goals that the state of Oregon has identified for the region.
So it sounds like it's valuable to take time and look at the bigger picture and then try to quantify it in this agreement, but the bigger picture is the goal. That's
the
wonderful.
Bigger picture is the goal.
Yep.
Yeah.
Good.
So Janice, do you happen to know how many people have been treated then for addiction disorders under this plan, approximately?
I would have no way to know that because we only track the different entities that are part of this contract, just track who we provide services to. And obviously the St. Charles is part of this, CUEPA is part of this, and they provide some services to people with substance use disorders. Best Care is part of this contract. So it's a much broader number of individuals than just who Deschutes County may serve. As you know, we serve roughly somewhere in the range of 5,000 people a year, and a percentage of those individuals is served exclusively because they have a substance use disorder. In our case, most of them have co-occurring mental health and substance use disorders. Again, long answer, but I don't know the total number for the community.
So just so I'm clear, this is a contract we've already approved. All we're doing today is just approving amendment to that contract.
Correct.
Whereas the one we just did was actually the original contract.
Correct.
Okay.
The one that was like 10 months late with the new employee at Pacific Source, which further compounded the
Well, it's a
loss.
complicated matter, but I'll move board signature of document number 2020-291 Pacific Source Amendment number 2 to the CMHP.
And I'll second it.
Any further discussion? Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. Thank you, Janice. Thank you for joining us this morning.
I will sign off. Have a good day.
Yes, thank you. Okay, Mr. Anderson?
Thank you, Commissioners. This morning, we have a presentation. I believe Tyson O'Connell from Wishcamper Development is plugged in via Zoom regarding an affordable housing project on the southern portion of the city of Bend off the Parkway at Pine Brook. They are seeking county support for a property tax exemption, which is allowed under the city of Bend and state rules for in exchange for the construction of this project. That waiver would allow the project pencil, which Tyson will go into. They are also presenting, in addition to the city of Bend, to the Bend Parks and Rec District and Bend Lapine School, seeking similar support for the project. Just mechanically, if the board's inclined to show that support for the project, we would bring back a resolution at a future meeting formally supporting the waiver of taxes for the project. So I see Tyson on the screen. Looks like I haven't met him, but I'm assuming that's him, or at least a representative from Wishcamper to talk about the project, to describe it for you, and to answer whatever questions you might have.
Yes.
And if I may, Chair Adair and Commissioners, this is Lynn McConnell from the City of Bend. I was hoping to introduce this project team and the project, if that's okay.
That would be great. Thank you.
Fantastic. Thanks so much. It's really great to see your faces. I'm here for several reasons. As you all know, I'm the Affordable Housing Manager for the City of Bend. The times that we are in right now are unprecedented. And the last recession really was just too recent for all of us. But I'm so glad that we have lessons to guide us this time around. We know that maintaining our construction industry is vital to our recovery, and that we're likely to continue to grow throughout whatever comes next. We need to be able to maintain our construction pipeline and keep pumping money into our region. We don't know how this event will play out, of course, but I can bet that we're likely to need even more housing on the other end. This development and affordable housing development generally succeeding right now is absolutely vital. I think that this development has very great potential for a good return on investment, and wanted to make sure that you guys knew the city is also considering this request. Our council will hear it tonight, and it's on our consent agenda. So as you all know, affordable housing can be a catalyst for development in this area. This refinement area, the Murphy area, has not had a whole bunch of uptake since it was rezoned and the urban renewal district was created. Folks are watching this development to see if we can get a few extra additional roofs in the area before they move to develop the commercial space up north. So we really think this is going to be a great catalyst for the Murphy refinement area and this whole kind of south, east and west, 3rd Street and Parkway corridor. In terms of economic recovery, again, great ROI, hundreds of jobs that will be created or maintained by this development. And I'm not going to put Tyson on the spot right now, but I'm assuming that he has been sending a handful of folks in our region home with some paychecks already through the planning and pre-development work. That is, of course, more important than ever now. The tax exemption in this project will expire right around the same time as this urban renewal area or the TIF area. And so we will have the benefit, once those things expire, of considerably more revenue than we would without passing the exemption. And finally, I think the benefit to the residents can't be understated. Affordable housing is more important than ever as we see how the current event ripples through the economy. Affordable housing is absolutely a platform for economic mobility and helping people be able to save by not paying too much for rent so that they can move out to unassisted housing when they're ready. And of course, the folks who would qualify for this development are the people who may be hurting the most right now. Our grocery workers and nurses, tourism and retail workers, paramedics, childcare providers, and more. So you'll hear from Tyson O'Connell and Kelly DuPont from the Wishcamper Development Partners. They work out of Montana, but have set up shop, a handful of folks from this team locally to make sure that they understand the Oregon climate and resources here. I found them really great to work with, and I very much hope that you'll consider this request today. Thank you.
Thank you.
Thank you very much, Lynn. I appreciate the introduction, and thank you all for hearing this presentation and this project, and also just for keeping things moving along right now. I think over the last 8 weeks, I sure didn't think 8 weeks ago that we would be doing business like this and moving forward like this, but I really appreciate everybody rolling up their sleeves and making things happen. And as Lynn said, during this time, I mean, this project was badly needed in Bend before, and I can get in a little bit of that when I have a brief presentation. But during this time, the easiest thing to do is to throw up our hands and say, boy, we'll shelve this and do it later. But at this point, that's not what we need to do. You know, we're forward thinking, and I know Bend is too, and there's a great need for affordable housing. So we are grateful that everyone is coming together and helping kind of move things along. I'm going to share my screen, and Sharon, I had sent, I think you may have this already. I did update it. We got some new renderings from our architect this week, so it may be slightly different on the renderings, but everything else should be the same. It's a pretty brief presentation. Let me just make sure. Okay, so can everybody see sort of a slideshow PowerPoint? Can you see that right now?
We actually have that on hard copy, but thank you. Yes.
Great. And is it on the screen as well?
Yes, it is.
Great, perfect. So you do have it. I think the only thing that's not in your hard copy, unless you got it last night or today, would be these updated renderings. But if you did just receive them, maybe it's in there too. So as Lynn said, we're planning a project we call Stillwater Crossing. It's down in the Murphy area. And it's, if you're familiar with that area, as Lynn said, it was an urban renewal district that has, I think it was created in 2008, somewhere around there. And not a lot of it is developed. And there's a number of reasons why not a lot of it is developed. But one of the things looking at it with my developer hat is just, you know, you kind of need someone to go first and to get things going. And in an affordable housing project like this is a great way, because we're going to have 240 apartment homes in this area. And I can walk through a little bit about that. Our planned project start date is August, so it's coming up in a few months at the end of summer. And then the project completion date would be April of 2022. And we have 7 buildings that will be coming online staggered throughout that period. So the first building would come online in July of 2021. So you're looking at just over a year from now would be the first building that would come on. And then the rest would be staggered through. We have 7 phases. Let me just figure this out. So Wish Camper Development Partners is our company. And as Lynn said, I'm in Missoula, Montana. Kelly's in Missoula, Montana. I guess our main office is in Missoula, Montana. We started about 40 years ago, I think, in Portland, Maine. Joe Wishcamper is our founder, and he's still a principal of the company. And then his son moved to Missoula, Montana 16 years ago. And so Missoula has become sort of the hub. And as Lynn said, we also have an office with 2 people in Portland. We started doing more business in Oregon over the last couple of years. And specifically in 2018, Margaret Salazar used to work at HUD, and she was hired by Oregon Housing and Community Services, OHCS, to run OHCS. And the first thing she noticed when she came in was, wow, Oregon has a massive need for affordable housing, maybe one of the highest in the country. And we're not utilizing our 4% credits to create affordable housing. We're using 9%, but that's such a limited supply, you'll never catch up with what you need. So she started brainstorming and got together different industry experts, specifically the president of the National Housing and Rehabilitation Association. And she said, hey, I need some help getting some developers together to do a brainstorming session to figure out what resources do we need and how do we create affordable housing in Oregon. And Tom reached out to our president, Joe Wishcamper, and he and one of our other principals, Fletcher Ray, who's in Portland, they spent basically 2 days, but an entire day with OHCS and with another group of national developers talking about what are the challenges in Oregon and how can we address those challenges. They're not unique to Oregon. The one thing about Oregon is your people really want to live there. And so you're growing really fast. A place like Bend, it's like hyper fast. And there are tools in other places, and there are tools that Oregon has rolled out to help make that happen. Based on that meeting, we said, we're in Missoula, we can make, and we have an office in Portland, we can make more of these projects work in Oregon. So we shifted a very big part of our focus to new construction in Oregon. It's not our only focus right now, but it is the primary thing that we're doing. And we said, we're going to find a way to create 1,500 units of affordable housing in Oregon over the next 4 years. With that, we spent a lot of time looking into communities, deciding where we wanted to go, where the needs were the greatest. And we currently have projects proposed in Bend, Woodburn, Beaverton, and Roseburg. And the Beaverton Award project just got a Metro Bond Award this week. So that project looks like it's full speed ahead, just like Bend. I'm not going to get very deep into this, but I just do want to know there are different tools for what soft funding, if you want to call it, for creating affordable housing. And Oregon has some pretty good tools. They have real estate tax exemptions, which are major, because what that does is the lender will allow you to say, okay, if you're not paying real estate taxes, your operating expenses for the year will only be this much, and then you can borrow a much larger loan. So that's a big deal. SDC waivers on a new construction project, depending on the community, can be a big deal. And then Oregon created this, it's called lift funding, which is basically we need to pump money into 4% projects to make them work in areas. Of course, Metro bonds are another thing, and affordable housing funds are another resource. We're using Lift and Metro Bond on our other projects, but in Bend we're not. And there's a couple reasons for that. One, Bend is in that category of it qualifies as urban, so it's harder to compete against in the urban category for the lift funds, and they don't have any Metro bonds. So I know in talking with Lynn, she said, boy, I wish we had more, but they do have enough. Bend has enough with the real estate tax exemption and the SDC waivers and the affordable housing funds. And in order for us to be able to make this project, to make it work and to be able to complete it and to keep all of the units affordable, we're a mission-based company. We will keep all of the units affordable. We need to get the SDC waivers that are available for Bend and the real estate tax exemption that's available for Bend. For those of you who are familiar with this area, this is a high-level bird's eye view of our site plan. We went back and redesigned this. We started working on this project in November, I think, and we're pretty much ready to submit for land use in January, but then we had our neighborhood meeting, and during some of those neighborhood meetings, there's certain things that are NIMBYism that you can't get over, and then there's other things that are really productive things that helped us, I think, design a better site. We added a lot more parking. We added more open space. We added some additional services and a splash park and stuff like that. And a lot of this was based on what the neighbors wanted to see and what some of their concerns were. So this is the redesigned site. We have a bird's eye. This is a bird's eye view of the site. So what it'll look like. These are the different apartment buildings. We have a really nice community space. We have a maintenance place with a pet grooming station and mountain bike fixing or repair areas. And then we have, of course, bike storage all throughout. So
Tyson, I actually have a question. I noticed that the other three locations are on the other side of the mountain, but several years ago, Bend had feet of snow that stayed on the ground for months, and I noticed that there's no covered parking, I believe. I couldn't see it in the plan. I just wondered, is that such an expensive item to add to, affordable housing?
So it's a great question. We would love to add covered parking. and it is expensive. Just to kind of talk about how thin the margins are on a project like this when you only have a 4% tax credit, which is still a great subsidy, but it's just not even close to as valuable as an 8% tax credit, which are what most affordable housing projects are built with. It is ultra skinny when you do a project like this. And so we are building what I consider to be very, very nice. It will not, I mean, they will look like market rate projects, but there are some things that we just have to, that are trade-offs. One of the first things is covered parking. We'd love to have that, but we can't accomplish, the development and do covered parking throughout the whole thing. And we have a very similar climate here in Missoula, and as Bend, and probably I think actually get a lot more snow than Bend, but the bulk of even market rate projects here in Missoula, some of them sure do have covered parking, and usually they charge for covered parking, but the vast majority of them don't have covered parking. It's just economically a really hard thing to add.
I just was wondering, how many parking spots have you added?
We have, I think, total 350 with give or take a couple. It's right in that range. I think we were at 355 at one point. You can see all of the parking that we put along the parkway here on the road. So I believe in the land use opinion that just came out, I think we actually meet the market rate parking requirements, which is something we really want to do. We'd rather have more parking than less parking. For affordable parking, you actually only need one unit or one parking stall per unit. So that would be 240, but that would be underparked in our opinion and based on our experience. We have
And
one other.
definitely it would be under. So, yes. All right. Thank you. Sorry to interrupt.
No, I appreciate it. Here's one of the other renderings, just to kind of show what it will look like. These are the basic color designs. We haven't finalized all of the color or finishes, but it'll be pretty similar to this. And I would open it up now that you've asked the question. I'd open it up to anybody else to ask about any of the other questions, and I'll just leave it on this slide here so you can, if you do have any specific questions.
So Tyson, I'm Phil Henderson. I'm one of the commissioners. I've done a lot of building and worked with a company that did a lot of building here in Deschutes County. Familiar with that. I was wondering how this compares. We've had active in our community for many years, Pacific Crest and Housing Works, which have both built multiple projects for affordable housing in the area, and I think primarily do use the LIFT funds. We've had some exposure to the whole LIFT fund program, et cetera. So do you see yourself as different than them or similar to them, or are you familiar with them?
Multiple part question, but very familiar with them. They're well respected and do great work. We're similar in the product that we will build and the residents that we'll serve. The difference is they're using 9% credits, I think, and maybe they've done 4%. We could ask Lynn about that, but they're using 9%. So typically their projects, if I had to guess, and I know some of their projects, but are probably in the 40 to 80 unit range. And that subsidy is worth more, and that's what works. If you can do projects of that size. In order to do a 4% credit, because it's so much skinnier and it's so much more leverage with loan proceeds, you have to do much larger volume. So that's why we have 240 units here, and you have to take out much larger loans. So you have to have we have to guarantee those loans as the developer. You have to have financial backing. So what it does is it just creates a less subsidized project, but in order to make it work, it's the same project. It's just a larger project on a bigger scale. But we do know them, and Housing Works in particular, their director, when we told them, when we go into a place, we say, hey, how can we work together? What can we use for synergies? Are there ways that we can work together? And in a very respectful way, we were told you're not going to be able to make a 4% deal work in Bend. It doesn't pencil. It won't work. You won't be able to raise the amount of proceeds. There's not enough tools to do the subsidies. And
So you're challenging
we're stubborn, and maybe because we
conventional wisdom.
make
So
it.
that's okay. What I know it's in the packet here. We've got quite a few pages of packet to look through to understand your whole project. But just real roughly, what are your funding sources as you project them now?
Sure. So our funding sources are about a $33 million private loan. Hopefully affordable housing funds from the city, which we're applying for $500,000. And a TIF loan from the city. And then the federal equity, which is what you get for the tax credits, which will be almost $11 million on this project.
So your rough cost is about 45 million for the project?
Yeah, it's 49 million, but it may have been 45. Yeah, it's 49 million.
One of the things that I've noticed in some of the projects, doesn't sound like yours are that anywhere near that, but some of the projects, the actual cost of doing it is, you know, over $200 a foot, sometimes $300 a foot. And I've always thought that's one of the issues I've always had with subsidized housing, which is largely what some of this is that's really a high cost per person, and it's all being paid by other, you know, the original costs are paid by taxpayers. So it sounds like you're lower than what I've seen in other projects. Is that correct?
For $108 a square foot.
45 million divided by 240 isn't 108.
Right, the hard cost of construction,
Okay.
what we are.
So the land and the development costs, the roads and the sidewalks that's another portion of it.
Yeah, correct.
Yeah, okay. And then how do you, you said that's great, you have the aspiration to meet a certain profile of renters. It's a huge need in our county, as you've expressed. It's going to be a bigger need now, actually, but it's been a big need for many, many years. So that's great. What do you do is it just through an application process, or how do you regulate the renters, or what do you call it?
Qualify.
Qualify the renters.
Yeah,
and then
that's a
continue
great
the
question.
program into 10 or 20 years.
Great question. Let me see if I can do this.
Thank you, Commissioner.
Can you guys see what I just drug over to that screen?
Nope.
Yeah.
Still on the.
We're looking at your plan still.
Okay, let me try this. New share. Kelly and I practiced this, so maybe I can do it. Now, can you see it?
Barely. It's quite teeny. We can see it.
Maybe it's a page in your
So I
document.
will just say, it's a very good question. And what is required when you do a low-income housing tax credit project like this is for 15 years, there's a tax credit recapture period. We'll have a 30-year affordability period, which we usually extend even beyond that. But for 15 years, if you rent even one unit to someone that is over the income levels, you can get the tax credits for that unit recaptured. If you rented more, you would get more units recaptured. So, and then in addition to that, you get a flag on your, it's this 2530 flag, and you can't do development. And since we work all over in different states, we can't have those flags. And so we have a management company that qualifies every single person that comes in. And the reason, it's probably really tiny, but basically at 60% AMIs, just like Lynn said, it's working class people who need housing very badly. Yeah. And it's $32,000 for a household of one, 36 for a household of two, 41 for a household of three. So it's that's the limit that you can make to living here. Now, one of the cool things about the LIHTC program is if you move in and then you get a promotion or you make more money, you don't get kicked out. You could live there forever. You could end up making $100,000 and living there forever, $100,000 a year. What practically happens in this kind of housing, because it's not Section 8 subsidized housing where the government's paying your entire rent. In this case, people typically move in. If they do start getting a higher income, they end up trying to buy a house, somewhere else, and then they just naturally kind of move out. Some of them do stay for a long time, but it is something that becomes a very stable housing, even if your income does grow over those levels.
Okay. What is do you know what, it's probably in your packet, the average rent for the different size units?
Yeah, the average rent is $860 for a 1, just over $1,000 for a 2, and $1,100 for a 3, which is a savings. It's about 22% lower than market rents for a similar thing. So this will look just like a brand new. This is the neat thing about it. It'll look like a brand new development. In fact, there is a development just north of here that will look pretty similar to this. It's a market rate development right off the highway. And if somebody goes and looks at those units and they look at our units, ours would be very similar in finishes and quality, and yet it would be 22% less than if they had to go rent a market rate unit, which if there's no affordable housing, that is what they have to do in Bend. That's what they're doing right now.
Well, it's a huge need.
And it might be an even bigger need. What, starting next July? Isn't that where your first one is?
Yep.
Okay,
Yep.
supposed to be done?
July of next year would be the first building, and then every 2 months we're bringing on a new building.
So we're talking about a property tax exemption request for a 20-year period. Is 20 years kind of locked in, or does that end up being calculated for the project, or is it just the palatable request, or how do we come up with 20?
This is Lynn McConnell again. It's the state statute that limits it to 20.
Okay, yeah, so it's just a hard number. Okay. Great.
So that's what you're doing, is you're asking that we don't tax these properties for 20 years. Is that essentially what we're doing for the county's property tax?
And we're representing multiple taxing districts. Tom, maybe you can help us with here. So the general fund and the police and 911.
Commissioners, I think the annual forgiveness on the overall property tax is a little under $40,000 per year. But you're right, that is spread across our general fund tax rate, the sheriff's office.
I said police, but I meant sheriff, yeah.
911 tax, and a small one for extension 4H.
Yeah, so we're each one of those districts, yeah.
Right.
The total for all the districts is 40,000?
A little less than that per year, correct.
Per year.
That's the built out total. I mean, right now I think it's in a TIF, but it would be only a couple $100 you're collecting. But once this is all built out and assessed, you would be, I calculated it at just under $39,900.
Thank you for that number.
Well, and I think, yeah, Lynn mentioned that it's already under the tax increment financing urban renewal, and then that's generally out 20 years still, so both of these would expire at some point.
Correct.
Yeah.
And then, as I understand, you're going to then go to all the other taxing entities like Parks and Rec and the school district and the city and all those to ask for the same kind of exemption.
We are. And the way it works is if 51% of the taxing authorities agree to it, then we get the whole exemption. So I just chose to go to every single person to tell them, here's our project, here's how it's going to impact you. I think some developers may not even go to every jurisdiction. They may just go to the largest jurisdictions to meet that 51%. But we've already presented to parks, we're presenting to county today and city, and then schools next week.
What portion is the county?
14%.
It's around 15%.
15?
Remember that chopped up dollar presentation?
Yes.
We have in some of our community presentations.
Yeah, 14.8 actually. I had it wrong. I had it rounded.
Well,
That's a great presentation, by the way. That chopped up dollar was good. It was good for me too to look at all of it.
good to know. Well, I'm supportive of proceeding. This is affordable housing is going to be real important. That south part of Bend will be a growing place for many years. City of Bend and some of the other districts they have to digest this concept also. But as a commissioner, I support.
Is that a motion?
I don't know that we're voting today.
Yeah, with just general direction from the board, we'll prepare a resolution and bring it back next week. We'll likely just put it on consent unless you'd like to.
Well,
further.
we haven't read this. I mean, we had so many things in regard to the COVID-19. I'd like to read it, at least. So we'll at least want it on an action item, I think, or I would like.
Well, that's
that.
fine. Yeah.
That makes perfect
Yeah,
sense.
so we can discuss it and.
Yes,
Sure.
and it'll be interesting to see, definitely, I do believe in the need. I'm sorry that parking is so expensive when you're dealing with, you want to keep it down at $108 a square foot, but considering our climate here, sometimes we really do need covered parking.
Well, a follow-up question to that would be: have you done the numbers on putting in carports?
Yeah.
So how much does it add?
I'll have to do it for 240 units. It adds a lot.
It seems like we see some apartment complexes where there's some covered parking. Maybe, maybe that's what you're saying, at 240, and then the other 110 wouldn't have to be. Is that what you're saying?
Well, I think we could do, if we only, it would look weird, but we could do 10 of them if we only wanted to do 10 to pay for that. But I think that the cost benefit versus all of the other things we're putting in and all of the required things and the amenities that both we need and the city of Bend wants in their developments, is covered parking is always a wish list item for me that, maybe on 10% of the projects it actually gets put in, and on a 9% project where you have a little more subsidy, it may get put in. But because we're taking out such a large loan here, the lender is looking at this and saying, you're pretty leveraged on this. We can't have a lot more construction.
But I think we're just asking what the number is, just to.
Yeah,
we're informed.
I can get that information.
That's all.
Thank you.
Thanks.
So just so, Commissioner, so I'm clear, we'll put this on an action agenda. Is next week too soon if you want to study it more, or should we push it out 2 weeks?
Do we have the public hearing next week? Is that going to be on Wednesday?
Yes, we do.
We do have a public
That
hearing.
is, the transportation, TSP amendments are, I believe, on the 15th next week. So 14th.
Okay.
So we could do it in 2 weeks if that's still.
Would 2 weeks be soon enough? Hopefully. Yes. Is that okay? In 2
Fine
weeks?
with me. I think they're the ones that are.
Right, or do we need to, we should make it happen next week, honestly.
Yeah.
Just ask,
handle
I
it
would
next
ask
week.
Tyson is.
Yeah.
Yeah, Tyson, do you need an answer?
Well, next week would be great. It would be next Tuesday,
Wednesday.
Wednesday are our meetings.
or next Wednesday. Let me just look at something.
Could you please?
What's the hearing on next Wednesday?
Transportation plan?
Yeah, next Wednesday would be great.
Would that be fine?
Yeah. It'd be,
Okay,
Oh, that's not gonna.
okay. All right, so we will be bringing it back then next Wednesday. Thank you for your presentation. Now, are you you don't work in the Portland office then?
No, I'm in Missoula.
Missoula. Okay. All right, great.
Thank you.
Thank you so much.
Thank you.
Okay,
We're ahead of schedule.
that's a miracle. I love to be ahead of schedule. Don't you think? All right, so I wonder if our public health update, I'm not sure if Justin would be on the phone this early. Whitney, are you aware? Okay, all right. Because we have 3 people from Summit BMC to be joining us. So should we go then to, is the draft plan going to put us over 15 minutes probably?
I imagine that discussion will take some time to
I know.
go through, but it's,
So I have one public health update. I don't know if other commissioners, if you received this email from Senator Boquist yesterday, or if you're on his mailing list, which I
Yes.
am, but I don't know why. Are you on it also, Tony?
I'm seeing emails from him,
Yeah.
yes.
So there was one yesterday that was really interesting. It was really a OHA update with a lot of detail. Because I don't read most of his, I mean, there's so many coming in, we don't remember, but this has a lot of
And the zip
breakdown.
codes.
Yeah, I'll finish my sentence.
Sorry?
please.
You're getting there.
A lot of information about what symptoms people get, what they show, a lot of things on, contact with the cases, how many are in congregate living. It actually has how many deaths are in certain facilities. It's really interesting. I don't need to necessarily review it today, but I thought if you haven't seen it, it was one of the more interesting ones to look at because it gets into so much detail. And then at the end, there's a bunch on by zip code, the number of cases. And so I was looking at our cases, and so 97701 has a lot, 97702 has a lot. Let's see what the other ones are. 97707 has very few, that's south. It's really an interesting, and one of the things was regarding to the underlying, we always see the underlying medical conditions, and it goes through what the, see if you've got it also, Commissioner Dare, it's on what page, okay. Trying to find, it actually lists what underlying condition they each have, and where people live. So, for instance, of the reported risk factors, contact with confirmed cases, 27%, congregate living, 18%, independent conditions, 35%. Those kinds of numbers are really fascinating. But it also listed by the conditions. It was interesting that prior smokers had a much higher percentage than current smokers of being an underlying condition. That was interesting. And that diabetes, I think, was higher than, or heart disease was higher than diabetes or lung problems, which was interesting because you would have thought because it's lung related, but the ones that has to do with death. So anyway, just passing that on as an interesting thing.
No, I thought it was actually fascinating that cardiovascular disease was at the top. And where is, it's page 7 of 16, but then my question is, where is obesity? Because I'd seen that obesity was way up there. And actually, if you take out the numbers from New York and New Jersey, the rest of the country, the numbers are.
Well, here it's the last item. It says it's only 10%. But that seems really, but maybe we have less
I'd seen other
obesity.
places where obesity was really much higher.
Well, maybe we have less obesity than other places too. I mean, it's
Well,
hard to say.
we've had so few deaths in our state, so.
Yeah, but don't you think that's an interesting chart?
Mm-hmm. Yeah, it was really, it brought out that, what is it when you have underlying health conditions and, and it's what our health department's philosophy is to get people healthy.
Yeah, so just for the record, 32%, 32 cases with diabetes, 28 with lung disease, 62 with cardiovascular disease. And then, I don't know what neurodevelopmental, that was 47 cases with that. I'm not sure what that constitutes.
And I will mention Sisters had 0. So that was
Well,
good.
we've heard that. Well, we've heard that, and the Pine also is
So
at
that's zero,
zero at
right?
this point.
Yes.
And Sun River is zero.
Yes.
97739 has zero.
Yes.
So we are, we can just look at those numbers.
So, yeah, I saw a version of that report, and it is getting a lot more interesting previously. So it's the weekly report from Oregon Health Authority. So I'm looking at the header that you have. So COVID-19 weekly report,
Yes.
published on Tuesdays. So, because as I say, I did see a previous version of it, but I agree, it got real interesting this week because they're able to break out by zip code around the whole state. And that'll evolve over time and get even more interesting. I'm sure it's available online. He was able to, as legislators, they must be getting it directly and then forwarding it to us as
Yeah,
commissioners.
they give a lot of information.
So, yeah, Oregon Health Authority weekly COVID-19 report published on Tuesdays.
So, yes.
So just another item. So I want to take a moment and thank our public health department. We've done this a little bit in the past, but one of the things that came up recently was the fact that there was going to be a kind of an all-hands meeting, and that just slipped away weeks ago now, and now weeks are slipping by. We have our new public health director, Nahad, is working hard, and I know we might have had one-on-one meetings planned with him last week that got canceled because we're just deep into this. So just a message out to our public health department and the staff and the leadership working with us on this. This is the event that puts them in the spotlight, and I want to thank them very much for what they're doing. Public health is population health. It's everybody. Some of these reports start breaking it out by age and ethnicity and, statuses, and it's just interesting. But it is population health. It's everybody in the community, and this is what they focus on. These are the professionals that do this job. So a special thank you out to our public health department in the Tri-County area and around the state also.
I actually had my meeting with Nahad, and it was fascinating. His father is actually Swedish and still lives in Sweden. He went to Northwestern, Emory, worked in Egypt for a while, and he is the lucky parent of 6-year-old twins. So and they just had their birthday last week. So anyway, I know when he gets home, he's very busy. So, can you imagine twins, 6? But it's great to welcome him on, and also to thank Hillary Saraceno for staying on, continuing to serve Deschutes County. She has been a key figure in our public health, and we so appreciate her. So thank you, Hillary, and welcome, Nahad.
Thanks very much for the acknowledgement, commissioners.
Yes, so this is good. So, Dr. Conway, we're still waiting for Justin.
Yes.
Did you have any update for us? I noticed that the state actually said we met several benchmarks, so that was good to see for our region, for our health region.
Yes. Well, we're up to 80 cases, and the rate is not accelerating. Excuse me. I have some things to show, but I don't know if you want me to start that or wait till you're. I suppose I could do this if you're waiting on them.
Well, we're still waiting on Justin, so you have exactly 4 minutes.
Okay, well, let me share the screen and move to some other materials.
So Whitney, is that a confirmation? Then we got one more case in? Yeah, he just said 80, so we were at 79. But I think we didn't have any for a couple days.
Yes, there was another case, and I believe there may be additional additions that we don't try to preempt.
I'm sorry to interrupt you. I just want to let you know that Summit's on with you. I didn't understand the *6. So
Thank you,
sorry
Justin.
about that. I'm sorry.
*6 is pretty difficult. Dr. Conway, do you mind waiting for Justin and Scott and Dr. Massine to go ahead and give their presentation?
It'll be fine.
Yes, Justin. Thank you again for joining us. We would like to hear, if you want to update us with what your health organization, Summit BMC, is doing currently. I know we're working on expanding your testing.
Yeah. Again, just appreciate everything I know you and your colleagues are doing. You've done such a great job during this global pandemic to get us going again, and so thank you. So from last week to this week, we've spent a great deal of time working with our surgery centers and trying to provide them, screening during this period, and also trying with the existing COVID PCR test that we have to get it within 48 hours, get our results from our reference lab in 48 hours. So we've instituted with the surgery centers a pre-op screening for both Cascade and Ben Surgery Center. We've been working with them. Any patients who fit the criteria come over, and we have again, using our process to test those folks before surgery so that we can meet the governor's mandate there. We've expanded the ability for our parking lot testing for people who are symptomatic. We've also expanded with one of the surgery centers and given the ability for their employees to be COVID tested. If they have no symptoms, they can still come over, and we wanted to make sure that as the surgery centers reopened, we gave as much assurance of safety as possible. On the rapid testing, our machine's up and running and good to go. The remaining issue for us is getting supplies for it. The number of so we have that ability. But the number of tests we have are so minuscule, we don't want to throw the doors open to begin doing the rapid testing for everyone until we can secure supplies. And so we're really trying to use the rapids for high-risk folks that really need it. But Scott, you want to add in anything?
Yeah, we're on our positives too. When we're doing that, we've been getting 1, maybe 2 a week, so we're at 20 since we started doing testing for send out on that front. Our rapid test is a test that once collected, it's completed in about 15 minutes, which is a great time frame for a PCR test. But again, limited supplies and make sure we can handle that before we open up doors to more. And we are working on the IgG platform, but we haven't rolled anything out with that yet.
Yeah. When do you expect the additional testing supplies? What's your best guess?
We're hoping to get about 100 per week for the rapid test. We're looking pretty good on the standards sending out to our reference lab for the 3-day turnaround time for patients. That volume seems pretty steady, that we're getting 200 to 300 of those a week if we need to. But it is a 72-hour, 3 to 4 day turnaround time on those tests.
Yeah. I think under the governor's plan, we had to have countywide up to 600 tests per week. So between what you're doing and other providers in the hospital, it seems like we are meeting it pretty easily.
Yeah, and we were more than willing to, each week keep updating you with how many we can get in. So between the rapids and the existing 3-day tests, I think if we can let you guys know, I think if we run what we get every week, we could probably be 300 or 400 of those, and the 600 needed. So if you guys know that the community is doing the other 200, then we should be able to meet that. And we're more than willing to report to you every week. It's just the availability of these things it really changes in the moment. Sometimes we can get a hold of quite a bit all at once, and then sometimes, we're lucky to get half of what we order. So we're really trying to see if we can get into some ebb and flow of predictability on supply.
Justin, I have a question. Who is the rapid testing coming from? What company? I just would like to have that down.
It's coming from the Abbott. The platform is
That's what I thought.
The ID Now platform. And it's an RNA molecular test, which is much like PCR. It's very similar to PCR.
This is Commissioner DeBone. I have a question about that. Is there any kind of separation of scenarios where you would use that rapid test or the regular PCR test going out? I mean, is it getting up to speed where it's good results and expected response?
So, for the surgery centers, we don't want patients if they have one that's more of emergent and we can't get it on the 72-hour turnaround time with the reference lab. we're definitely using in that situation so they don't miss their surgery date on those. Or if potentially results don't come back on one of those collections due to delay in testing, that we could try to use some of that testing to, again, help the surgery center make sure that those patients who all got pre-op and ready to go get that surgery for that day. So we are holding some of that in reserve for any of those types of scenarios. And then we do have some ability to bring in patients for our own procedures within our clinic just to make sure that they're safe on those types of procedures.
Yeah.
And are you testing for surgery patients all the time, or only when in doubt, when there's some kind of symptom?
So we've tried to set criteria with each surgery center set that criteria, but they're very much the same between each. But definitely high-risk patients, age is an issue, and the complexity of the issue that people are coming in for has some determination on that. But we're essentially letting them decide based on their screening criteria, and then they send them over. We test them.
Great, thank you.
Yeah, absolutely.
Justin, I know that St. Charles was going to start their surgery opening up on May 11th. Are you matching that date, or have you guys already started?
The surgery center started on May 1st. So we wanted to make sure, though, that we did everything we could to support those two locations and opening back up. So we started the COVID screening and testing with them, and we've been doing it all this week too. So.
Right. So the first surgeries are actually this Friday, but we have to do the collection 3 days prior to them actually performing their first surgeries.
When you a little bit about the healthcare business here. So are you talking about surgery centers that aren't part of BMC, but you're working with them to make sure that they can perform or operate?
That's right.
Okay.
Yes.
Okay, and what were the names of them again?
That's Cascade and Bend Surgery Center.
Okay, good.
We've been trying to work with both of them to make sure that, especially for our patients, we have the right pre-op screening. We're not sending someone over with symptoms, and that they have the COVID test if they're in these categories that, so that we have the maximum safety available before somebody goes into the location.
Right. Have you been approached by any employers about being able to test their employees so that, say they're going to be in the public, it might be a restaurant or a store or, some kind of place that, because I've seen this on the national news that certain businesses have lined up testing. There was a jet company in Phoenix that had lined up with some other provider, and so they had everybody tested, so it gave them, I'm just wondering if that's going to be a model we'll see, that somebody comes in and says, I want to test 15 people, and they're all willing to be tested, and you'd be able to do it because you had enough materials.
I think in the long run, we'd love to support anybody who needs a test, period. I think in the short term right now, I told you on the last call, our big concern are how many people have delayed care for things that aren't related to COVID. And, I think in our clinic, we're starting to see a lot of the negative outcomes of that. So we want these high-risk patients and these people who've delayed their care and procedures, we're trying to, really focus on getting them the test first, since we have such a limited supply. But yes, sir, if we could do that in the long run, we'd be happy to. Anything we can do to help or participate to help businesses locally, we would love to do that.
Yeah, that seems like it could be something we'll see over the next month or so.
So how are you reaching out to those high-risk patients, Justin? I realized that was one of the unintended consequences when the hospitals really shut down for quote-unquote elective, non-essential surgeries. Are they seeming willing to get back in and get their health care up to date?
Yeah, I think probably the Cascade and BSC could answer that probably a little bit better than me. But from what we're seeing with our patients, these people, a lot of the pain patients, people who are getting screened for colon cancer, things like that, they didn't see it as so elective. So yeah, I think they're more than willing, especially with the safety steps that are being taken, to to get that work done, especially people with chronic pain and things like that. I mean, taking 2 or 3 months of a delay in that, people had to live with the pain during all that period of time. So anything that they can get relief from, I think they're very open to it. And I think the medical community all around, everybody included, the hospital through every clinic, has done such a great job on trying to mitigate any chance that someone will catch this. And I think it's starting to shine through to people. With we haven't had a major explosion in cases, and everything we're doing with masking and screening and things hopefully will make people feel safer as they go out and try to get this delayed care taken care of. So.
Yes, I will look forward to the fact when we have our Central Oregon Health Council meeting in person again.
Yeah.
Like that will be yes, we will feel a lot better that day, don't you think?
Definitely.
What can you talk a little bit about? I think you mentioned, or maybe Scott did, the IgG, or I think that's the antibody testing. Is that correct?
That is correct. We have a kit in that we can run, and we're trying to get validation on it, and it tests for the IgG and the IgM aspect of the coronavirus.
Our major issue, sir, with that is there are so few cases that we have of positives to get a quality read and make sure the machine's calibrated. We have to find some folks who actually have had it and get them to be willing to come in and help us with a sample, because there aren't QA samples floating around of people with coronavirus. So you kind of got to find a couple people who have had it and have them be willing to come in and help. So we're working on that now to get the machine quality, the quality really good for a positive or negative.
But the other piece of that is there's not a great amount of literature that if you're IgG positive that you're immune to the test.
Yeah, for sure.
So on that front, a lot of people and providers don't feel like the test should be put out there because it may give a false sense of security to people that do have a positive IgG, that they can't then re-get the coronavirus, and that information hasn't been validated yet.
Yeah, that makes sense.
I think if we do end up doing it, we will definitely try to make sure that everyone who gets the test understands all you're really getting is a test that says you had it or didn't have it, and we want to make sure that the percentage that there aren't a lot of false positives or false negatives one way or the other on that.
I believe we have 58 in Deschutes County that are considered recovered. I thought that was the last number I saw. So maybe you could, maybe they'll want to participate just to see, and that would actually help your your calibration of your machine and just see, okay, is this really working or not? So no, I'm so glad that you're here in our community and you're part of the team. So keeping our citizens safe.
And if you need anything from us, just let us know, and we're more than willing to keep coming to you and giving you an update weekly or biweekly or whatever works for you guys. But thanks for leading the community on all this stuff. We really appreciate it.
Thank you.
Thank you for being on this morning so much.
You bet. Have a great day. See you guys.
Thank you. Okay, so now.
That's interesting.
I know, it is pretty Abbott Labs. Okay. Yes. Oh. Dr. Messine? Oh, Dr. Messine, are you there? Is he not from Summit? Okay. Yes, he was on my acknowledgement of who was going to be available today. Maybe something happened. All right. Dr. Conway, are you available now? Do you want to give us your brief update?
Yes, I am.
Thank you.
So as we just actually a footnote to what you just mentioned, our total number of recovered individuals is 63 at this juncture.
Oh my gosh, we're really getting up there.
And I'm going to find the right prompt to share screen. Here we go. So there's a couple things that I wanted to just let you know about. You should see Sort of a brightly colored blue chart. Are you seeing that?
Yes.
Okay, great. So I mentioned to you that Emily Freeland, or one of our environmental health specialists, twos, has been detailed to assist local businesses in preparing for reopening. And I think I showed one very sort of summary thing. This is a very nice overview of the work that we're doing, which summarizes the approach that's being recommended. So this is COVID-19 responsible protocols, and there will be sector-specific protocols available, we believe, by the end of the week, working jointly with the sector groups that the Chamber, City of Bend, and EDCO have been organizing. So the guiding principles include protect the health of employees, customers, and their families, support community efforts to control the spread of the virus, and lead in responsibly getting Deschutes County back to work. This is the summary of the 4 best practices. First is, and then there's a 5th, recommending face covering for employees and clients, customers at all times, and we will talk about that more later. Conducting daily health assessments for employees, a self-evaluation to determine if fit for duty, maintaining good hygiene at all times, hand washing and physical distancing, cleaning and sanitizing workplaces throughout the workday and at the close of business or between shifts, and then limiting capacity to meet physical distancing guidelines. And then this is designed to be able to be posted by businesses, and they would fill this in. And this is the request of the customers or clients to join in this effort. I think this is a very nice summary. This is one of the individual guidelines on sanitization. I won't make this more tedious by reading to you.
So, Dr. Conway, before you get too far, do you anticipate then people from our staff going, and so we get the word that all child care centers are going to be allowed to reopen or whatever. We actually put together a team of people to go visit each business and inform and that sort of thing, or how do we?
No, I think the model will take. So we're working on the sector design. There are types of, as you will know from the fee discussions and whatnot, there are different types of enterprises that we do inspect regularly, such as restaurants, those that provide food trucks, et cetera. We're developing these guidelines. I believe what we're going to take is a consultative model that, if requested, we will be willing to provide information on site, and if they ask for evaluation, that. But I think these would be far too numerous for us to undertake. Certainly trying to inspect everybody, especially since many of these businesses will not necessarily have established guidelines or regulations to refer to other than the sort of vertical ones.
Well, just followed up with that. So I bet most of these businesses have thought a lot about this because they've been closed for weeks. And one thing you do when you're closed is you think about what you're going to do next and how you're going to do it. So I'm not sure that you couldn't do, and they may want to have people come by and just sign them off, so to speak. I mean, I'm not really saying we should inspect them, but you figure out the number of people that can be in the retail shop, you explain the rules, and then they're able to put I mean, I could see as a business wanting this. It's not always true that businesses want all the government posters you get, but this is one that they may want, and they may want to put it on their front door. So I could see us wanting to do this, wanting to help people this way, and it may not. I mean, it may be we could maybe do a broader group than just your health department. I mean, some of these things are kind of commonsensical. So I don't know. When you say we're working on this, do you have a team that beyond just the health department that's thinking about this? I know, yeah. So
the City of Bend, EDCO, the Chamber of Commerce have organized sector teams Ms. Freeland has been attending each of those, providing technical support. She's helping compile and design some of this material for outreach. My understanding is that across the sectors, the number of individual businesses, now, once again, since restaurants and food service are one of the most numerous types of enterprises, we have a relationship with them, a proactive one. So that's implicit. But for the other sectors, my understanding is that the sector teams and our staff that are involved are supporting that and would be available for consultations as requested. I think trying to cover anything routine beyond that, unless it's something that's required by regulation, I think would probably be far beyond the resources available within our department. Now, I haven't attended the sector teams. I'm happy to bring Ms. Freeland and Mr. Money to talk to you about exactly what's going on and provide that information.
My understanding is what you're calling a team is made up of a lot of the people on the team are industry people. So there are other restaurateurs, for instance, or other retail people. So I'm not sure that's quite what I was thinking of. I was thinking more of something independent of that. So that would be something to find out. I know I think they have a seminar or something next week on the third. Is it on Tuesday? Or Tom's nodding his head. That is for the purpose of training people in various industries what their standards are. Is that right, Tom?
Yeah, no, as you know, as we talked about last week, the Chamber has been coordinating a lot of that work and are coordinating seminars on various means of assistance for businesses that are considering opening, and that work will continue. And just to pick up on what George said, I know capacity is a issue. We've committed to providing that assistance in our draft reopening plan language. So while there may be some capacity issues with who we have now, whether we can work with the Chamber and maybe train some trainers or something like that, or add some temporary folks to help do that, I think that's a central part of our reopening strategy.
Sure. To piggyback on what Tom just said, so the fair and exposition, I'm sorry, Tom, you might provide the name of the working group that Jeff Hines is convening tomorrow. I'm sorry, I don't know that. I can't remember the right
That's
name.
a different issue, George. That's the Fair and Expo Board meeting tomorrow.
Yeah, but I was pointing out that we've offered Ms. Freeland and Eric Money to talk about the guidelines that are being developed elsewhere and in what ways they might be applied for that purpose. And then as far as the teams go, the teams are collectively developing sector plans. But once again, when I was referring to consultations, I was referring to our staff would be available for consultations as requested on anything technical.
Well, yeah, the reason I was thinking about our staff is because this is our forum. It has our name on it. So it seems like it has to be Deschutes County people that are.
Yes.
Yeah.
So the underlying logic of this, so with restaurants and food service, we have underlying relationships and there's interval-based inspections. And they have to pass that to proceed with their business. For many of these other enterprises, I think it might be awkward for us to just sort of descend on them without their inviting and asking for a consultation. So I think that's probably the best approach, in addition to the numbers. That I think that as you mentioned, people have been working on this a lot. They're very motivated, and there's a certain level of trust that we're assuming that people have been engaged and involved in this and attentive to progress will do their best. And then those that ask for help, whether it's technical assistance or if they need help in finding material, et cetera, we're very happy to help with that. Begin to make the reopening safe.
Okay. Great. Thank you, Dr. Conway, for joining us this morning. I'm sure you're going to want to take part with our draft reopening plan. Whitney, are you going to be leading that? Or is Tom?
Definitely will. And just to point out on the draft that George just shared, Elise West actually, who as you know is normally with our team at Fair and Expo, but has been giving us some help in admin, is working with Emily and designing those materials. So she's leveraging some of the skills that she normally puts forth in marketing the Fair and Expo facility and helping out with health services needs, and she's doing a great job on that suite of materials. So I just wanted to point out to the board that she's doing a lot of work on that specific project.
Thank you, Whitney.
Great.
Yeah, Commissioners, we can proceed at however you would like with this. We provided to you last night and this morning a number of things, documents. Yesterday you received from the Health Department a pretty specific matrix that addresses the governor's 7 prerequisites for opening very directly. There was some missing information on the regional aspect and also from St. Charles. Then last night, Whitney and I, mostly Whitney, assembled that information, embedded it into your existing draft reopening plan that we've been working on the last couple weeks at what we thought to be the appropriate places. So you've got sort of a blend of the two documents in draft form that we're happy to go through with you, if you like, that preserves much of the language that you have already worked on and provided your input on with respect to those 7 criteria. We also received confirmation late yesterday from the regional individual from the Oregon Emergency Management Department that we meet as Region 7, Health Region 7, the 5 items within the prerequisite checklist that are necessary in order to proceed. So we have that kind of official confirmation, which we have also noted in the updated plan that that those criteria have been met as certified by the state.
So on that must be what Annette Levy put out an email today on. Is that correct? Because we didn't see.
Yes.
I don't think I saw something from an emergency.
I've not seen Annette's email. So
Annette's email came out.
So you said we met 5 of the criteria, and I'm looking at the prerequisites deal. It has 7 criteria. So which
Well,
2 don't get met through the?
in the checklist attached to the governor's criteria, you see a county column and a health region column. Are you on this document here?
Yeah, I know what you're
I'm looking
talking about.
for it. Well, I'm looking for it. So
Okay.
on the 3rd page of the document. Okay.
So there are, under health region, which are the ones that are to be met at a region level as opposed to the county level, there are 5 green required boxes under the region column. Those are the 5 that the state has certified that we meet.
Well, that's excellent that they were able to get that done. I mean, I thought we'd be waiting a week for those, so. So the other, okay, good.
So as I said, we've noted that in the updated draft document in that green text with a check yes on it, that state regional certification has been made. And then finally, last evening we received a response from St. Charles, who we had sent our draft from last Friday to, that contains 3 different documents back to us. One was a critique or some input on the specific items that we had sent them last week. So we've since updated that, and I have transmitted to them last night the updated document. So hopefully we better meet their advice as they articulated in the first letter, first document. The other 2 documents are basically their certification or their statements that, where they are with respect to PPE supply and surge capability, those things that are noted on the checklist as needing to come from our local hospital system. So we've not yet embedded that. We can, at your direction, since we just received it, we're happy to go through that as sort of one of the final pieces to having the plan ready for submittal. So with that as kind of an introduction, we can, again, proceed how you wish, go through the draft plan, or since you may not have had a chance to review it much, or touch on each of the documents that I've mentioned.
But you have a question. So on the cover is the COVID reframing, but then we have the reopening plan, the draft May 5th, 2020. Is that everything put together then, the very last document?
Yes, the most current clean draft is titled Reopening Plan with a draft date of May 5th, yesterday evening.
So it's in the back of our packet then, that one?
Yes, I
Okay.
think that would be the one. And we, not to get into the weeds, but apparently there's specific criteria that when you call something a recovery plan, that has an emergency management connotation that is, it means something different in the emergency management world. And so with feedback from Nathan, we altered the title back on this document. So it's now reflected as a reopening plan, and we're happy to adjust that as the board might see fit.
And then following up what you said, Tom, thanks for going through the documents. That was my first question, is what do we have here? There's quite a few. You're saying these two letters that we got from St. Charles aren't yet put into the reopening plan, the content of them. So we still have to integrate those two. They're good letters. I mean, there's a lot in them. But we need to still integrate them, or is one option to attach them as an exhibit? Or
Well, the first letter that has proposed recovery feedback
Yep.
on it as the title, that was, the bulk of that is a critique of an prior draft. So I've sent to them our new draft, the same one that you're looking at this morning, last night, and asked them if they wouldn't mind sort of resubmitting a letter based on the updated information that we've included in there, because many of the items that they note in there, correctly, suggest that these areas be strengthened, be elaborated upon, and we've actually done that in our updated draft. So they were the letters based on an old draft when I think the new draft better reflects. So that would be, and once that's done, it's up to you. We could either embed this language from this letter in an updated draft, or simply attach it.
it seems like that first letter you're talking about actually has kind of two parts. The first part, which is called proposed recovery feedback, is kind of commentary on our draft. And then part two is actually what we might need to have right in our document. It says exactly where they are on stuff. And so it almost seems like we could divide that up and, input. The second letter to me seems like it's really very specific to what their role is and what they're required to do and how they've met their requirements. So isn't that kind of how you read them?
Yes, I think that's exactly right.
Okay. Well, I'm in favor of maybe going through our reopening plan, knowing that we still have to integrate in some things from the hospital. I guess that'd be my suggestion.
I agree.
Commissioner?
I want this plan to get over there. So I just want them as an attachment, but I'm outvoted. So yes, I'm looking at
Well, we haven't
their
even talked
letter.
about it. I just said what I thought. We haven't voted on anything.
Well,
You don't
I'm
wanna-
looking at the memo and I'm saying, okay, the testing and everything, that our region has already been approved, that second letter dated May 5th. So the state has already said that we have sufficient hospital care capacity, we have minimum testing established. Yes, so, I guess the state has already said that, but, attaching the letter from the hospital, to me, just documents what the state has already said.
Well, one way we could integrate it in is not integrate the whole thing, but integrate it in by saying, as required, attached to, we could integrate it in with a couple sentences.
Right,
It
with a
just
couple
seems like
yes.
you don't attach exhibits unless, you say why they're
Reference to it.
there. So is that,
That would
That's
work.
something
I'm sure
we
Whitney
could
could
do.
do
I mean,
that. She's
not
only
trying
done
to-
this document about 1,452
Little
times.
so I think we're all anxious to get it over there. So the other thought was going through the plan.
Yeah, I mean, we should
I'm
kind
interested
of
in doing
flip through
that.
the pages for
Yeah,
sure. So
yeah.
I've reviewed it a few times, but yeah, I haven't really had focused time to pull anything out and redline it. I do have a couple questions, but as we go through.
Okay, great. So let's start on the table of contents.
So just by the way, we have provided you both a clean copy and a red line copy. Those are two of the documents in there, so it's whichever one you'd like to follow along with. But we heard loud and clear that you wanted a table of contents up front in the updated document, so that's what you see on page 2. That, again, the 7 items in green match specifically to the 7 prerequisites identified in the governor's document. And then again, the idea was to preserve much of the text, much of the language that you've all provided. So that's what you see in the introduction section on page 3.
So maybe,
Okay, page 3.
I know there was quite a few edits to the second paragraph, it's a long sentence. Just put a date there, as of this date, 80 known cases, whatever, because it changes daily as it's published, so I
So-
know that's the intention, but just maybe put a date in that sentence anyways. Because if for the reader in the future, they can say, oh, okay, I see what we're looking at.
So you're saying 5/6/2020 that we have to have 80 there?
Yeah, but I mean, as I say, whatever date we publish it, include the date in that sentence, Yeah,
Now we have 6.
May 5th or 6th,
We
7th,
have that
yep.
chart
Yes.
too, which we're
Yeah.
to get done to.
So, yes, and 63 recovered. That's a very positive number. 63 out of 80. So, does anyone know if the woman that had the plasma transfusion, if she's still in ICU? Has anyone seen a story on it? Okay. All right. I just was wondering, since they were covering it on the news. Anything else on page 3? Then we have to update the negatives and all that too, Whitney? Those numbers?
Yes, we will work with health services and get that paragraph dated so it's a snapshot in time, make sure everything is up to date, and then also work with Jenny Faith to get an updated chart for that section.
Great.
I really like how this is looking, colors. I mean, I know all the other counties have pictures of their county at the front page too, but I like the fact it's looking really professional, so
Great.
it's great. Good. And the charts of the hospitalization.
Yeah, so beginning on page 4 then is the first criteria. We've kind of checked that box. The charts that were provided by health staff certainly show that hospitalization as one indicator of declining prevalence is certainly present. There is no one there. We've got that there were specific information requested in the governor's recent criteria in terms of hospitalizations and what is being seen in emergency rooms. So that's reflected in those charts.
And so the chart needs to be a little bit updated with a couple more dots.
She said she'd do that.
Yes, Commissioner, those are available daily. Michael Johnson is sending them, so this is what was pasted in a couple days ago. And incidentally, we do have one person currently in the ICU, so hospitalized.
And are we actually doing Walmart testing at this point? And that's in I'm on to the next page. But
6.
what's that? I'm on page 6, yeah.
That was information, and Dr. Conway can probably expand on it, that came through from Health Services. I read that to mean that it is not currently happening, but it will begin. But Dr. Conway can probably elaborate on a more detailed status update there.
That's all I know, that they are planning on standing it up. They've made an announcement. I'm not aware that they are testing anyone yet, but it's quite possible that I wouldn't know that if it happened today.
But even if we're highlighting positive motion forward, the thing that, like we just heard from Summit BMC, that they've added Abbott last, rapid testing capacity that could be up to, I forget what he just said, per
200 to 300.
per week. I mean, that would be worth calling out if we're going to call out Walmart. I mean, it's.
Well, I agree, and I think that's important for planning. However, as County Administrator Anderson mentioned, we already have basically a green light to go forward, because this is one of the variables that was ascertained at the region level, and we have some neighbors that we're doing quite a bit of testing, including Klamath County, so that this, I don't think that we have to make a stronger case here. However, having said that, we need to continue to press very hard, increase our testing, hopefully to a point where we can also be testing people that are mildly symptomatic at minimum.
Isn't our requirement really 600 tests per week?
It now says 660.
Yeah, well, 660 would be, because of the rate. It would be 660 for Central Oregon or 600 for Deschutes County. But yes, however, for purposes of going forward with reopening, Tom, maybe you can weigh in on this, but my understanding is the document that we read from Katerina Stiles essentially says that that's been satisfied at the regional.
It does. It's not, our current requirement is 600. It's not 660. And that's going to continue to be true. I mean, if we're putting an application, we should just say what it is we're required to do. I agree that it's been met. I get that.
Right. Well, so there is a table that shows it by county, and you can see we're up to 24.7, and we had a substantial increase in that antecedent week from, you may recall, the week I showed you before, it was 351 to 477. So it's a substantial increase. So I would say we're sanguine that we will be at that 600 level in the next week or two, barring some unforeseen either supply chain or some other.
600.
Whitney, could you put 600?
600, thank you.
So we're at 457. That's great.
477 as of the
477?
477 as of Monday. So we enumerate the Monday to Monday. So this latest stat is 477. It's on the top of page 7 in your draft.
Great. All right. Thank you.
I'd like to go back to the charts real quick, so page 5 or 6, depending on what version. So in the version that had all the red lines, we have a kind of a band, light blue band that was going on these charts. And this maybe, Dr. George, you'll know, was that some kind of estimate? Because both of those are increasing slightly. It's like an error band.
It's kind of faded in this version.
Uh-huh.
Band is a confidence band, so it's basically a range.
Yep.
And the reason that's done, it shows as a band around the data to date, but then you can see it's rather faint, but that gives you a sense of the projection at the current rate going forward.
So they're both expected to go up, and I noticed the band is not on this other version. Is that just not printing, or are there different versions of the chart?
I think it's just not vivid. I don't know. Whitney, do you want to comment on that?
It does show it real vaguely on mine.
It's in the document. I think it might be when that document gets generated into the packet, potentially, where there's some, but yes, you can.
Well, yeah. Maybe you could put a key that says confidence band, because I didn't know what it was either. I was trying to figure out
What is that?
Well, and as I say, I'm acknowledging they both look like they're stepping up slightly, and is that a statement in there? That's kind of my question.
Okay.
So, and this is a
What do you mean?
3-month period, so 5, 6, 7, 8, 4-month period maybe.
What do you mean by stepping up?
The bands go
The band is
from
actually rising a teeny bit on
1 to 2 on the bottom one and 1.5 to 3.5 on the top one, which is minimal. But I'm just trying to understand what that's saying.
Sure. So the projection, if you see in the header, it's with intervention. So that's assuming the persistence of social distancing as is. So one of the things that would be interesting is to follow and see what happens as things are relaxed, and whether we see, not just interesting, but very important thing to follow, to see if we see a concomitant increase in these more serious cases as we relax things.
So, but even with intervention in the next 3 or 4 months, all hospital beds with interventions, that confidence band kind of grows ever so slightly. It doesn't go down.
Yes, and actually, if that's a confusing element, I'm sure that Mike will be happy to send me a version without that background. I mean, we're working very closely with St. Charles. It's once we decide which day we want the point to be at.
Yeah, I think it just should end today. I mean, I just don't think there should be anything to the right of today because all the rest of it's speculative. So
Yeah, well,
that's
so
what you're saying. Is
along
why
those-
is it what it is, and why does it go up a little bit? Well, we
Yeah.
don't. It might go up 10 times as much, or it might not go up at all. It might go down. So it's all speculative.
But along those lines, there has been statements made that at the end of the summer during traditional flu season, we could see a spike in activity. So I don't know that our document needs to state that, but that's information that we've had. The fact that even if we have a summer period, 3 months or 4 months where it lays low, we almost need to prepare for a fall resurgence. I don't know that, as I say, that's information we have. I don't know that we want to put it in the document at this time.
We can also create a graph de novo with the same data. If you want, Dr. Faith, I'm sure can do it very quickly. We have data in Excel format. It would look a little bit different than this because we would be just the actual rather than the census. We don't track.
At this point in time, that'd be appropriate.
Yes,
Thank you.
I would agree.
You're asking that we do that?
Yes,
Yes.
please. Thank you.
I'll reach out to Dr. Faith this afternoon and ask her to get on it.
Okay, so what page are we on now?
I believe we'd be on page 8,
Yes.
number 3, contract tracing. So the language that's in the matrix now under response, I mean, we've checked that box, obviously, that we're able to meet that, to do it. You worked on language fairly, rigorously on kind of putting that in a frame that you were comfortable with. So we've used your language from the previous draft to put into the box. It does look different than what you saw that came directly from the health department yesterday. But basically, and it notes the capacity issues that we have now, but also says what we would need if we either saw a resurgence or some other reason why we'd need capacity over what we have. As you know, we've kept up very well, Jill Johnson and her team, with the investigation so far. However, to meet this threshold that's been identified by the state, we would have to expand our capacity, and whether that's with new employees, whether that's with employees assigned to us by the state, contracts, whatever. What we heard from the governor's staff on Friday afternoon is that they don't expect counties to have to go out and hire people, that they are intending to provide resources at the state level to assist with.
They actually said something differently on Monday because on our call Tuesday morning, they said, nope, that's not what the state is really going to do. But Tom, do you remember when we had the volunteer tracing program in Deschutes County? I believe that it wasn't renewed when we lost an employee in 2017. Oliver Tatum sent an email on it saying that we did have a group in our community that did do this. We know there's a 2-hour program, a YouTube program on how to do it that Baker County had implemented for a couple of their citizens. Do you remember that team through the Health Council?
I don't. I would probably.
Okay, I think we received that email, and I actually I forwarded it to the health department and asked if that was a possibility to bring that back.
Yes, we've done reconnaissance. I have talking points in front of me if you want to hear that.
Yeah, there was a good note on that. Was I the only one that received it? So
It was from Oliver.
yeah, and I had forwarded it on also, and there was a couple paragraphs responding about the history of it, what it was. It was basically, well, and yeah, Dr. George can
Yes.
Well,
share.
just the short version is that there was something that's now dormant called the Public Health Reserve Corps, and that the funding disappeared for that a few years ago. The individuals that were enrolled in that were also enrolled in Serve-Or, which is organized at the state, Serve Oregon. And the advantage of that is that that covers the liability when volunteers are deployed. The idea of volunteers is very appealing, but we have to differentiate between ones that are, if you will, trainable or having germane experience, because it's a really technical process and requires a fair degree of expertise, versus those that might be able to play some supporting role. OHA, we have curriculum and we have trained some other staff to be able to do contact tracing. OHA may be organizing centralized training. So the idea of volunteers, though, we have to be very, very careful that they're trainable to the level of necessary training, and that they have some underlying skill and experience. So that's sort of a maybe indelicate thing to ask about and track when people are earnestly wanting to help. So there are other things that people can do to help, but contact tracing is once again, it's a technical thing. The other thing is that in order to be able to be useful in it, you have to be credentialed to have access to Orpheus, which is the secure database. It's within the HIPAA walls that local health departments use for communicable disease investigations and contact tracing. So once again, if they're retired or semi-retired RNs or MDs, or they've done communicable disease work in the past, then that would be suitable, but it'd be very difficult to train just sort of interested civilian volunteers to be involved in this activity, let alone to get them credentialed. However, the organizing entity is available in Serve-Or, and I believe that Serve-Or also has other opportunities for people that want to so enroll.
Whitney, can you update the number on that page to 80?
Yes.
Okay, I'm sure you probably already did.
So
Trying
when
to
I
save
look at
time.
this, I guess my input is I had a conversation with Nathan, and he kind of explained this to me too, so we changed it in the language that we may need to hire people if cases continue right now. Now I don't know how many tracers you need currently, Dr. Conway, but my idea would be that if we need additional tracing, there's 3 options, there's 4 options, whatever it is. We have a volunteer program of ex-MDs and RNs. We have people within our staff that we, try to convert over. We hire some people. But this reads kind of like, well, the first thing we're going to do is spend $500,000. And I don't know when we really would pull the trigger on that in terms of moving forward. It just seems like to go hire 3 or 4 people now doesn't make sense. So it seems to me what we should be telling the state is we have multiple ways to do it. And that's, to me, would be the most convincing if I was at the state. Now, they may come back and say, no, we want a specific plan. And one of the others is OHA has sent us sent messages. At one point, they were saying they were going to train a bunch of people. And as Commissioner Dare said, this week they said, no, that's not what they're going to do. And so, with the original stuff sure read like they're going to go hire 600
Right,
people.
600 people.
Send out the army of tracers to all corners of the state. But
For the 100,000 people that they are going to be testing.
yeah, but I just don't. So I would think this should kind of be a here's ways we can do it, get there if we need to. But we would
can-
step up.
We can definitely get there multiple ways. I agree with you. According to their staff needs plan draft that we received, the conclusion was that they needed additional 3 staff are needed to maintain current ability to fully investigate.
Who's that from?
This is from the DCHS there was a draft they gave us.
DCHS.
I know.
Deschutes County Health Services.
Right.
It was their draft.
So, yeah, so maybe Dr. Conway can clarify that. Are there people that,
If I may,
how many people do we need today to be doing tracing, I guess is one question. Then
we're doing quite a bit of tracing. We're still following a large number of people under monitoring. So once you have people that are cases, they identify contacts, as I mentioned last week, because the age has gone down, the average age of the cases, we're having more contacts per case. So we're still keeping
Okay.
6 we have involved in
Give me
this.
how about a number? Just how many people are we tracing right now? And don't they only last 14 days?
Right.
So this,
For 14 days, and then you can have secondary cases. I don't have that number in front of me. We can get it. There was a background 2-page document called DCHS Contact Tracing Staffing Needs Plan that we forwarded yesterday that provides substantial background in this that Heather Keisner prepared. And then I also, maybe I was too.
I just read the summation. The conclusion was that you needed 3 additional.
Well, and so one of my thoughts is that this thing is, 18 months from now before we may have a vaccine, right? So, I mean, we're looking at 12 months to 2 years dealing with this possibly in our community. The next 3 to 5 months in the summertime, knowing that there could be a surge in the fall during flu season. So it may be appropriate to talk about adding staff at Deschutes County. Maybe not right now, maybe as part of the budget process, because that's coming up here in the next few weeks also. But in this document, we could make a statement saying we do plan on adding capacity
definitely
at
have
Deschutes
options.
County.
Well, and that, if I might add, the salient point is that right now we have our entire, the 6 communicable disease people with expertise we have are all working on COVID, which means that the other problems that we're trying to beat back, syphilis, we had congenital syphilis case, TB, gonorrhea, et cetera, none of them are kept in abeyance or at bay by COVID. So that means that we're accruing additional non-COVID problems. So the same urgency to go back to catching up on elective surgeries and whatnot pertains to public health. Right now, we are not able to attend to that with the current bandwidth we have. So in order to be prepared and continue to do surveillance, follow-up, et cetera, and we expect there will be at least a detection surge as we expand testing, as well as doing our important public health work that it is the day job of each of these 6 individuals. We need more bandwidth. And the idea of volunteers.
Okay, Dr. Conway, is it possible for Heather to answer? Is she available or is she anywhere?
I can try to track her down. She did
Okay.
write-
She's the person who prepared this document. That would be great if we could just hear from her first, because I would, it would be good to know what she.
Let's move along a little bit, and then I'll try to track her down and get her involved in the next few minutes.
So yeah, I'd like to get clear if this is a personnel request at this time or to be scheduled in the near future. That's kind of where we could go with this. Deschutes County, we have had resources. We don't know what the future looks like. It's nice to know that we've had this base capacity in our public health managing this, and now everybody's focused on one issue. So adding a few staff may be the place we end up, because we don't want to be in a situation where the state, and it sounds like, we got to watch out for the media. Sometimes, and we saw this a few times recently, the media will come to a conclusion, it'll be the headline, and people assume what's going on. I don't know what the Oregon Health Authority, if they really wanted to go hire 600 people. 600 was probably mentioned. I don't know if they were planning on hiring them.
No, we did see it in print, but then they changed.
But
the
I'm just saying, we
message.
could probably take care of ourselves. This is
Right,
Deschutes
we can
County.
do-
If we add a few staff there, and we have, health contact tracing available by the state, we'll have
We have
more
to,
confidence.
We have to be personally responsible
Yeah.
for Deschutes County. We do not, if the state had said one thing and then they said something different on Monday, then we have to,
Yep.
we have to be personally responsible.
So
So if I could comment on, so Mr. Anderson very prudently removed the staffing request part in the draft that we sent, because I agree with him. That really wasn't something that we needed to air in front of OHA in this document, asking for permission to proceed. On the other hand, to answer more bluntly, Commissioner DeBone's question, yes, there is an implicit personnel request in this, and whether or not I want to bring it up now because it's contextual, but if you prefer that it be deferred to the budget sessions, which are coming up, we can certainly do that. There's some urgency about this, but those are coming up soon. So so we did raise it at this point because it is a important issue for our ability to cover this need, and we do need to be poised to do that. And then I'm going to get off and see if I can track down Heather and see if she can join in.
Whitney, wasn't this number, this 584,000, wasn't that originally the cost of 5 additional employees? Was that the same number?
Yeah, it was.
Yeah, isn't it the same? So really that paragraph, I don't think is.
I think you're correct. And actually I had, yes, based on earlier conversation, it
Right.
sounded like that needed to come out based on Commissioner Henderson's feedback. So
Yes.
I think you're correct in that reading and that interpretation. And again, this is been a fluid draft.
I have a hunch Tom had a thought on
Yeah.
the request for a few personnel.
So the prerequisite calls out a specific ratio of 15 tracers per 100,000 people. We have 6 currently. So currently we don't meet it. In our draft, we outlined options and how we could meet it. So, and we relied on that as a persuasive argument to the state in the old draft. So we're still at that point. So our choice in finalizing the language in this section is we could do one of a number of things. We could continue to rely on, this is how we get there. We train volunteers, we hire contract staff. We don't want to rely on the state. I heard Commissioner Adair
Well,
say.
because we've gotten mixed messages from them.
What's the last paragraph in the deal, though?
Right.
But, so I think that's up to you and for us to discuss how we strategically want to describe our either existing capacity or plan for quickly adding capacity.
So I'm good with this paragraph as it reads, except I wonder if we shouldn't really put a first paragraph that says, we have, this is my words, we have serious questions whether we really need 30 personnel to trace the current or surge capacity of COVID-19. We've done it with 6 people, up to 80 cases. So, but be that as may, if we need to get to 30, this is how we're going to get there. Because I think they're way off on the numbers from what we've heard from George and Heather in the past. So it wouldn't bother me to put that in there. They may say, well, you got to take that out or we're not going to approve your plan. But on the other hand, it's true.
It's true. We've done it with 6
We've done it
people.
with 6, and they should know that we've done it. And so maybe something, and then the rest of this reads well to me. We give them options. And then the last thing is additionally, we could maybe get it through the state. We put that as the last option. So I think it reads really well. If maybe just take out the money part for now
And go ahead with it.
But what do you think about the idea of a first paragraph that kind of says, first off,
Well,
we want
we've
to
really
just
done
question
it.
this. We've done it for 2 months with this many, and it's been very successful. And
Well, I think that's indicative of the quality of our team. I think they know what they're doing, and they're really good at it. They had a great practice last year with measles. So, yes, something like that.
like that. I mean,
I'm not supportive of that. I mean, we don't need to pick a fight here. This is the plan.
It's just to be
we're
frugal.
not going to meet the 30. So what if they
Right.
come back and say you don't meet the 30?
Well, that's
You
where,
hire 30?
if the state is adding resources, so contact tracing, if we have local folks that are making the first connections, documenting who's who, and then the contact tracing can be done remotely. So It can be done from a call center with a database of call this person every 24 hours, ask them if they've stayed at home and if their symptoms have changed. So I think the
there's
state
a
can
million
provide
ways to do it. I'm just saying we don't meet it. So, and the fact that we have all these options doesn't meet it either. It says must have a minimum of 15 contractors for every 1,000 people, 100,000 people. We don't meet it, and we're not going to go hire 30 people or get 30 volunteers lined up just so we can.
Well, I guess I would say
that hair. So that's, I guess, my
if we
question.
get a plan that has this one outstanding item as a response early next week or whatever is going to happen here, that's fine. Let's talk about how we are going to meet it. And as I say, if the state is offering to provide some resources and we don't have an outbreak, we need to be ready if there's an outbreak. So, yeah, I mean, I wouldn't, as I say, I mean, the terminology I use is pick a fight, but I don't want to try to oppose the request in the first statement.
I think there's a middle ground there. I think
Yes.
what
Find some middle ground. I do believe that's important.
I think Mr. Henderson's exactly right in that it'd be ludicrous for us to go hire 30 people when we've been
Ludicrous.
perfectly able to meet the volume of cases that we've seen in the county with the 6 staff we have. So how could anybody expect us to go spend $500,000 when it's not needed? Right?
Oh, it would be more than $500,000 if we had to hire another 24 people, because.
Or some combination.
Yes, because they're saying 30 and we've done it with 6.
Personally, I think it kind of makes sense just to say, we'll keep up, and we've been able to keep up, and we don't anticipate, at this point needing permanent staff on hand. However, if we see a change in our current trends, we can do A, B, C, or D to quickly get to the point, and whether or not we rely on the state for help with that. But it just seems, we're not going to be able to check the box yes based on our numbers, but I think the qualification is maybe the best we can do.
We're clearly qualified. When everyone kept talking about contact, tracing, we were already doing it. I feel like our county definitely, that's something that they do an excellent job at. Look at our nursing home, our 33 long-term care facilities, and what an excellent job they've done in educating the people that work there. So, yes. Whitney, are you?
I was just going to let you know that Heather Keisner has joined the call.
Oh, great. Heather, thank you so much.
If I may, Heather is prepared to answer and discuss that. And since this may go on for a while, I do have to let you know I have to do a hard stop at 12:25 because I have a meeting with some of the deans at OSU about some surveillance assistance they may be able to give us. So, Heather, please.
Okay, can everyone hear me?
Yes, Heather, have you been listening to what Tom just explained as far as kind of a compromise on our opinion about how incredibly outstanding our team of 6 tracers has done?
I have not.
Okay.
However, thank you. So it sounds like you maybe want more of a clear explanation on what we're thinking as far as how to ramp up for contact.
Yes.
Well, before we go there, I'd ask the first question, which was, how many people are we following now, and how much is a lay person? I look at it as we diminish down to 1 or 2 new cases a day. Or do we really have 6 people that their full-time job is tracing from the COVID-19?
Yes. So to answer your first question, Commissioner Henderson, we have monitored 177 people so far in this response. And as you know, we're up to 80 cases. So Jill Johnson and I really sat down and looked at this, on average, how long it takes to investigate. It completely depends on how many contacts and what FTE it's taken. And I say FTE because we pulled different parts of staff, trying not to completely take them away from their day jobs, but it's been challenging. So we normally, in a regular communicable disease world, we usually have 2 full-time FTE responding to communicable diseases that don't include STDs. So that's our normal. And so what we did was, in order to respond to these growing number of cases, we pulled in an additional 4 FTE, mostly nurses and a couple health educators to help with the response. And really, it takes a high level of skill and technical, I think, expertise to do this work and do it well. And I think that's why we've been so successful. And it's been wonderful internally to pull these people in. We also have other people on hand if we saw a bigger surge. However, when I look at long term, and unfortunately, the disease isn't gone. It's kind of smoldering right now. We've done a really good job of trying to contain it. As we do more testing and we begin to open up our economy, I think we need to be prepared. And I really feel we need to prepare on a local level because we know how to do this. I don't want to completely rely on Oregon Health Authority. And so what Jill and I came up with was if we could at least, and it could be limited duration, hire 2 nurses and a health educator to continue this work for the next year at least, and let other nurses go back to their day jobs because a lot of those are revenue generating and their jobs are going to get busy again, and STDs don't go away, unfortunately. And so, the team is really, really taxed right now. And so we're looking conservatively if we could even just get 3 individuals, and then from there, if we needed more, I do not plan on hiring 30 people. I don't think that's prudent. What I see is if we could at least kind of own those 3 and really control the work, then if we need to expand, we rely on OHA. They are in the process of looking at how they can hire what they're calling strike teams that can come down and help us if we need it. I've also been talking with, other county departments and possibly the sheriff's office or police departments or EMS that kind of know, especially EMS, know this work, and could we pull people in if there was a surge and do just-in-time training? So we kind of see it as a scale, right? We start with our core group with these additional 3 staff. I think we can really still do some great work with just that core staff. If we have to expand, then we pull in potentially more internal staff if we need them. If we have to expand more, then we reach out to OHA and make that request. So does that I think that will easily get us to that 30 that they're saying we need.
So that's good. I think the question I'll try another way of saying it. So we have these charts where we started at 0 cases, and by April 16th or April 6th, we're up to 40 cases. Are we still tracing things from those first 40 cases, or part of them, or and if so, how many? What are we tracing for those people? 4-6 is a month ago, so that's when they first were identified. I don't know how many of those specifically recovered, but are we still doing tracing, and how many tracing cases can a person do a day, so to speak?
Yeah, it completely depends, again, on how complicated it is. I will tell you the most recent contact tracing we've done these last couple weeks, some of our cases have had quite a few contacts, and it's getting much more cumbersome for my staff because, as you know, people are hurting right now. People are pretty emotional and struggling, and so a lot of the contact tracers end up becoming almost like case managers and have to be very empathetic, and there's stories of them on the phone with them for over an hour talking with them, and and our goal is obviously to prevent further spread, but we also feel strongly that we want to provide supports where we can. So it's kind of a hard one to answer, but for as far as when we have a case, we monitor and follow all those contacts for 14 days. So that's kind of tells you. And unfortunately, I don't know what the future holds. What I would hate to happen though is we start to reopen and we continue to get cases, and I have staff that need to go back to their other jobs, and then my small core team of communicable disease folks, they're going to get pretty burned out. And I don't see us having fewer cases. I see us having probably the same or more, but we are really our goal is to track those, to prevent further spread and to contain it as much as we can. And so even if we have, a few cases, I see these positions as also really being able to help with prevention. As you know, we have one nurse who's doing an amazing job, Carrie Coe, with our long-term care facilities. She's working around the clock. She could really use a little bit of a break. And so I could use another nurse to help her with that. And there's definitely plenty of work on the prevention side and the response. And just so you also know, this team is 24/7, 7 days a week. And so, I'm trying really hard to give them each breaks and let them have a day or two off. But they've been going for a while now. So I'm trying to think long-term and be more proactive than reactive and be really conservative in that we're not asking for, I agree. I don't think we should be hiring 30 people by any means, but if we could just start with a few and see how that works.
So what you're saying then, actually, we could change the wording in our document, Whitney, and just say, we estimate per what Heather just said, needing at least an additional 3 public health staff to continue to support. Isn't that what she's saying?
Well, so that's the request from the health department. Tom's the administrator. We're talking about budget, and would it be the will of the governing body to add staff right now? And I'm thinking through that process. We're under emergency orders by the state of Oregon, and we have emergency order in place in Deschutes County. Putting a number there, I think of dollars coming from the federal to the state. If we're going to get local dollars, these would be dollars we're spending that we wouldn't traditionally be spending because of this COVID case. So then it's kind of the balance routine. Are we talking about a general fund, expenditure for 12 to 18 months? Or do we think of it under emergency operations where we may get reimbursed in the future? So there's a lot of moving parts to that. I support adding some staff at this time in the emergency situation, and I see that 18-month horizon. I'm just trying to put some direction to it. This is a document that, maybe we're going to talk about it at the budget committee meeting. I don't know that we need to make that hard decision today, but
Right.
setting direction to it may be the way to go.
Would we say Deschutes County Health Department estimates needing at least 3? Will we clarify with that?
We could put a simple statement. We plan on expanding capacity of locally by a few FTE, or, I don't know how committed we want to be, but we could put some words in there like that.
We could. I think if we're trying to think strategically about how we strengthen this language in this particular section in our reopening plan, I think, I wouldn't say we're not going to meet it. We're not going to meet that 15 per 100,000 because we're not going to go hire another 25 or so people. I think the more we can strengthen, we'll have the introductory paragraph that says we've been able to keep up through great work of our staff and with our, comparatively low case volume. And we plan on adding more, or we're going to have envision having more, maybe that's soft enough, to add to our capacity. And if necessary, we can quickly ramp up to meet whatever need exists in our county, up to and including this 26 or 7 FTE that is reflected in this threshold, or something, a strategic language that gets us as close as we can get without saying we physically meet it, which we simply can't.
And there actually may be some employees within Deschutes County that could move over to assist. So that's another clear possibility.
Well, I don't know how far we want to debate what we should do for the future. In terms of the plan, I think changing it, to Deschutes County estimates needing at least 3 additional public to continue. We know amongst ourselves that we have options. We may need more But the assumption that it's going to get worse, I mean, to get the first 20 cases in Deschutes County took 26 days. The next 20 cases took 8 days. The next 20 cases took 14 days. The next 20 cases took 20 days. And we're doing more testing now than we were back when it was going up faster. So what if the next 20 cases takes, more than that? Do we really need more? And that's why I was wondering, when do tracing cases drop off? And I still don't know that, but I can't imagine we're still tracing from the cases in March, I guess it started March 11th, so that's almost 2 months ago. Are we still
She
tracing?
said for 14 days.
Well, I know,
So
but
it's like, why would we would be still tracing those?
I guess for today, I think putting the language in there that we've talked about sounds good, and don't you think? Or, I mean,
Yeah, it can be reworded. There's a lot of good statements that were put out here.
well, do you want?
I like Heather's statement that when we have local capacity, we have kind of local control on that. And if we need more capacity, we'll ask for it, or it'll be obvious. But having those local relationships, a little bit of continuity with the local staff, that's going to give us foundational capacity.
But I think that's a discussion with Heather about, and Dr. Conway, just about what do we need for the future as things develop. This is just what do we need to turn into the governor's office to get approval. So there are two parts, and Heather will be real involved in the future of it too. So, but I'm good with just.
Okay, the really good news is we're on page 8, aren't we?
Yeah.
Okay. So.
Or 9 now if we've got through
Okay,
that.
so now we're at page 9. I think there's been enough clear direction.
Thank you, Heather.
Thank you so much for coming, helping.
Thank you. Let me know if you need anything else.
I think we understand more, so that's good.
That helped a lot, Heather.
So, beginning on page 9, now we're talking about isolation facilities. There were 2 items in the prerequisite document that touched on that. So we believe we can check both those boxes. The first one has to do with hotel rooms for people that need to quarantine that aren't able to do it at home. We've had a couple of discussions on that. There's an item later on your agenda today to look at a revised order for non-congregate sheltering. We are separately working on specific agreements, as I think you've been advised, for that shelter. So we think we can check that box, and the language there reflects it. The second one is what happens if there is a surge. And so we were asked in this prerequisite document to look at several examples. So health staff has done that, has prepared examples pertaining to long-term care facility, an outbreak in the jail, and one at a congregate shelter, and has included language on what happens under those scenarios. So we think based on that, we are able to check both those boxes at the county level.
Yeah, very good.
I think it's outstanding. I mean, I don't know where it all came from, or.
That's stealth. Yeah, it's Heather, and I think Heather wrote most of it. And
I think it's excellent. Way more detail than I had expected. So and I think they'll like it in Salem.
We could only hope. Yes. Excellent job. Thank you, Heather.
that was also one of the things pointed out by St. Charles that probably needed some beefing up, which is precisely what's happened. Okay, and now we are on page 11, and now we get into the business sector guidelines that we've talked about a little bit already. So we aren't asked to check a box there. The state has been, and sounds like it has continued yesterday to update those guidelines on what's required for the different business sectors. However, there's a lot of work that's been done locally, as you know, by the Chamber and the cities to gain feedback from our local businesses on what those regulations mean. So we thought you'd probably want to preserve that language. So on page 11, we noted that, and then we preserved the language later in the report. We referred the reader to page 16, where we've that sector-specific language.
I think it's great because you put it in there, you've teased them a little bit, so then they're going to be waiting for 16, but you're saying we're paying attention to all of it, and they're going to like that. I think it's good.
Okay, then on page 12, we're talking in both, most of both of prerequisite 6 and 7 have to do with a hospital. So that's where we've received language now from St. Charles that I think we can embed into those, that strengthens what, what's already been noted in there. So that's, number 6 has to do with healthcare capacity. So are we able to accommodate a 20% surge? Well, St. Charles has, that's one that the state has already said we meet as a region. So they've looked at bed capacity and facilities and population within our region, and they've said, yep, you meet it. St. Charles has now strengthened that, added to that with their language that we can include in item number 6.
Yeah, I think you put it in green, about St. Charles, and then you put it down right after that first paragraph. You say attached is the document laying this out. I don't know that you have to bring it all in. You could, that second letter, maybe it'd work.
And Whitney, it actually needs to say the 30 ventilators, 28 of which are on back order. One of my little details. So we've gotten 2.
Where are we? Oh, down there.
In the middle of the paragraph, the second paragraph.
Yes, that's a good catch. Thank you.
So you're saying we've gotten 2, so
We've received 28.
Good shape.
Yeah, we got 28 on back order, so yes. But what about where this, the next paragraph where the hospital beds, St. Charles to input data, how are we cleaning that up?
Well, we have it now. So that's
Okay, you'll put it in. Okay.
Yeah, good. Yeah, we got it today. Good.
All right. So, page 13.
Yeah, and then finally on item number 7.
Hold on. So they did give us the stuff for 6, because that was, remember, we were debating whether we were going to get it or whether they wanted to share it. That's great. Good.
We'll clean that up. And then item number 7 is PPE supply. So the first 2, again, has to do with supply at hospitals. So once again, the state has certified that we meet it as a region. That's in the letter from OEM. And then also St. Charles has warranted in their letter that they have sufficient supply to daily and also to a 30-day to meet a surge or looking into the future.
St. Charles, it was attached in a blue and a color document with.
Yeah, that's great. Yeah, that's great.
So.
I think that's
Excellent.
awesome.
Thank you very much, St. Charles.
And then
Appreciate the assistant.
last one under number 7 had to do with sufficient PPE for first responders, and through the good work of Nathan and the folks in the EOC, we meet those thresholds now. And that's documented in the green text on page 13.
So do you think they've met every category?
What's that?
Well, remember 2 weeks ago they were low on the gowns and on the N95s, but do you think they now meet their targets?
It's building a cachet. Yeah.
So what Tom just said, they didn't meet it.
Well, there's the prerequisite doesn't. It just says has sufficient.
Yes.
So it's a little bit.
So you're saying yes, and then we're telling them the numbers we're meeting.
That's what our targets are. We have things on order, which will definitely, and we have, 119,000 extra procedural masks.
So I just wonder, because we're so far over on some of ours, would it be worth saying, like the procedural masks, we had 3 times as many as we needed. I guess that was the only one
Yeah, that's the only one we're over on.
Well, no, the first responders had them themselves. Anyway, okay. Well, I just wonder what you say, Deschutes County is building and has built.
So do you want to continue on? It's now 12:30. Do you want to take a 30-minute break?
Well, the rest of it you've already seen.
Okay, so are we good with the rest?
Well, so I was on I was at Ready today, and one of the people on Ready was saying that they thought all 6 of those things we got last week were all in phase 1, and aren't there only a few business sectors that the governor's going to open in phase 1, and can't we put in a pitch for which ones we think are important to open? I mean, do you think that's in there, the way we say it?
I think the way the board articulated their preference is reflected on page 19, which is the last page of the document.
The last page.
Where what I think we thought we heard the board say on Friday was that you would support.
Page 19 isn't attached to mine.
Oh, I'm sorry. I think with all the changes I'm making, I have pushed potentially onto another page. It's the last page. It's
Reopening
the
local
business
business. Yeah.
page. But I interpreted the board's conversation to mean that you were generally supportive of businesses broadly opening, but we wanted to confirm that that was a correct interpretation of your discussion.
Well, and it does trace back to the executive order 2012, because that defines the businesses that are closed. And then also Central Oregon traditionally seeing a strong influx of tourists.
Where is personal services?
It's in there.
And what we heard, as Whitney said, we heard all of them. We didn't hear limiting to certain ones. We heard all businesses should be allowed to open with proper safety protocols. So if you'd like to go back.
Well, no, I'm looking at it going childcare, retail, restaurants, and I'm going, I just want to make sure personal service.
Let's start at 16, because the state has issued draft reopening guidelines for restaurant food service, retail, personal service business, childcare, transit, and outdoor recreation. So it's really issued 6. So, I mean, if we're informing them of what has been, that's what they've issued. And I learned today at this meeting that they've actually changed the restaurant ones, which, remember last week we were talking about how ardent they were? And I don't know if they've changed the childcare ones, but I mean, they're a moving target. But, so should we include all 6? For 6 sectors, blah, 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 blah. Because you're trying to say what's true, right? In this, Whitney, or?
And just to make sure I'm tracking, you're referring to the business sector considerations.
Yeah, the first sentence.
I believe that section, and Tom can elaborate here, is a reflection of the input that we've gotten from the chambers, the working groups, EDCO, all of our partners, the cities. And so I believe those specific sectors are the feedback that we've received. Tom, is that?
Yeah, so that first section, service employment, contains 4 of those sectors. Restaurant, retail, personal services, and childcare. So it's reflective of the chamber and city's work in talking to those businesses and what they mean.
Okay.
And we have heard that they have been updated, not by much. There was an article in the paper today.
I got it.
Yeah, that
right here.
It relaxed, for example, the requirement that restaurants get personal information.
Yeah.
But they've added that to the personal services category. So they're asking, if you go into a barber shop, they need your name, rank, and serial number in order to get your hair cut.
That's crazy.
Or something similar. But again, what we were attempting to reflect in these is that we're working with our businesses to try and adapt to whatever guidelines that.
So what this sentence really is saying, the state has issued draft reopening guidelines for 4 sectors that we've specifically spent some time working with in our communities. That's really what you're doing here. Okay. Yeah, that makes sense.
I would just repeat in that very, very last line, personal service, because childcare, retail, and restaurants are listed, and I would.
You're on page 19.
Yeah, but I would add it there too, Whitney, just to reiterate what we're talking about.
Commissioner Dare, you're on the last page, and
Right.
you are in the,
I'm on the 16 page.
I know,
You just,
I wanted to make sure it was there because it wasn't there, and it was,
you're in the last sentence. And I believe the reason we didn't call them out explicitly is because those businesses are outlined in Executive Order 2012. But if you want me to call them out specifically and reference them, I will be happy to do that. And I can note that in parentheses following the, I can make that work in that last sentence.
thank you so much,
So-
because we hear from those people on a minute by minute.
yeah.
Sorry.
So since we have this big section on service and employment, my suggestion would be is that we do put in that there's 4 particular sectors that we have a lot of local input. And that's why we're talking about it for the next 6 paragraphs or 5 paragraphs. So I would just have that in the opening sentence. So because I read it and I'm like, okay, but why are we, so that's really the heart of it, is that we've done more maybe than other communities, or we've really worked through this. We've got lots of involvement, or that's great. I mean, it's great to have it in. I just think we should have that in the first sentence.
We can do that.
For 4 sectors, which our communities have had intense involvement in, or whatever you want to say. I like, yeah, that's good, okay.
Then the 5th category, you mentioned outdoor recreation. There's a separate paragraph for that on page 17. And Visit Bend had already done outreach similar to what the chambers and cities have done with more outdoor recreation specific, like tours, rafting, so forth, in their outreach. So we kind of tried to capture that work, that a synopsis of what they heard from those businesses, which is basically they're committed to gradually larger groups, I think was the central theme of that work. So to the extent that there's now specific guidelines that have been issued by the state, we can blend those two and kind of, it'll be similar to what we're saying in the service employment section, that we're working with our businesses to adapt to guidelines as finalized or issued by the state.
I like that. So what about adding a paragraph on churches and faith-based facilities? Because we're calling out every other sector, and why not have that right before reopening local business?
And it concludes with that. The last sentence talks about.
Well, I know, but everything else we've given paragraphs to, and I mean, we just know, because we all feel strongly about this, that
I've
that's
got
important.
my church's packet right here.
So
Yes.
it's coming up with just a 1-paragraph deal, and then close with the reopening local business, something on, so.
Yeah, we're happy to do that. Is there any particular language that you'd like to see in that paragraph?
We proactively want churches.
I mean, just for,
Well, part of it's just the fundamental, the
Yes.
community's under stress. It's a fundamental or foundational element. I guess I could help with it. I haven't really thought about it very much.
Our community is struggling with anxiety, depression, and loneliness.
And it's our communities too. It's our communities.
People supporting
Folks.
each other, and
Yeah. It's foundational, it's fundamental, so I think that just having some, I'll help if we're, I assume we're gonna basically get a redraft of this later this afternoon to try to get something towards approving. That'd be my,
well, we can talk about that, because.
Yes, we might be able to do that.
we'd
Mightn't
have
we?
to excuse Whitney to go work on that, but yeah, I think we can.
yeah, I mean, either that or do a meeting tomorrow, but,
Yeah, as I say, I mean, if
No.
it's not today, it could be tomorrow.
because Patty wants to drive it over. Are you driving over tomorrow in the morning or
I'll
tomorrow
drive it over
afternoon?
whenever it is done. Well, I thought we were drawing straws, but
Oh, that's right.
I told all the ministers I would take their letters over with our
Yeah.
packet, so,
And
Yes.
if you do mind sharing that packet, I'd be happy to look at that.
yes.
I'd like to get a copy of the packet too. I wish we got packets. I wish somebody'd go through and make a packet out of all the short-term rental letters.
I have.
Good, well, share it with us then if you're gonna
It's in
take
my
that.
binder. I've been
We're
putting
gonna
them all
take that
together.
initiative. Let's get somebody to copy them.
Yeah,
I don't want any of that. I've got it all organized in my folders, and I've read everything and
Do you wanna see
responded the
this
way I
copy?
want.
Okay. I guess it's just one copy.
There's some, fabulous letters in here.
So you go through and put each letter where it fits. Oh, that's great.
Yeah, so when, yesterday and today, they came in very specifically on that one topic of short-term rentals.
Yeah.
So I, at some point, when it becomes an avalanche, I don't respond to everyone, but I respond to some of them. So that, and because I've been in this situation a couple times over the years now.
Yeah, no,
But I did a lot of responding yesterday.
Okay, I know. So.
Great. Well, we're getting closer on that document. Thank you very much for all the inputs on that. It's great to have St. Charles and our health department able to kind of get their words in and have them get stabilized.
Does that mean I do get to drive over then?
if you're
Or
dying to
without-
drive over, go ahead.
No, I meant, are we going to have, I thought you wanted to do a pick a straw. I thought that's what, and I only want to be fair.
You could probably just send it electronically.
No, we're sending it electronically, but I don't want it at the bottom of the pile. So I do believe that taking it over shows how sincere we are in the fact that
With
our
a photo of you on the steps of the Capitol with the plan.
Who's going to take the picture?
Oh,
No,
yes.
Selfie.
I don't think so.
Send her with the tripod.
I've got the tripod.
There you go.
These are my Zoomies. Well, I think it's, I filed things at the Supreme Court that way, but I've never,
Okay, so,
whatever you,
So the only thing that we wouldn't, we're not guaranteed to have this afternoon is an updated letter from St. Charles. That first one, again, reflects the old draft, so we could just attach the second letter and then incorporate the second half of that first letter into our document, and then attach the second letter that speaks to capacity and PPE supply.
or you maybe get somebody over there to just redo the letter with the,
Well, I asked them last night, as you saw, I don't know what their ability to turn that around today.
oh, I meant just, that stuff that was kind of summary in that first letter by itself is really the meat of what we need. The rest was commenting how to make the plan better, which we've done and tried to do. But then there was some substance in there that was different than the second letter, so.
Yeah.
Okay, so you're gonna try to integrate that into the,
no, I just want to make a comment. Think of those people that applied for unemployment at the end of March that have not heard one word from the state. They haven't gotten any money. And we hear from those people almost every day in Deschutes County. So I don't want our document to go over there and be lost. I want to know that it's on somebody's desk, and it's too critical. There are too many people that are depending on us, the three of us, to come through for Deschutes County and the 197,000 people that live here and all the people that are now unemployed. So that's why I don't want to just send an email. I believe hard copy is so critical. So anyway, that's my little message to our governor. We want our plan approved. We've worked really hard on it. How many weeks has this taken us?
Several.
Yes, several weeks. So
speaking of that, Damon, another update, Damon Rimmer was on the Ready call today, and he said that he thinks it's possible that with some businesses coming back and the healthcare elective surgeries and things coming back, that the high point of unemployment might have been last week. He's interested to see. But he says the number of claims being filed is less than they thought, than it was, and so it's real interesting to see what it is tomorrow, the Thursday. But he did say that that pandemic unemployment PUA, whatever A stands for, assistance program for all the self-employed and the independent contractors is proceeding, but it's very challenging. He couldn't tell me what the numbers were yet, because he says it's all being done kind of by paper, and people have to put in all sorts of stuff, and it's really a challenge. That'd be one area if we ever wanted to figure out how to help people. That one's probably the toughest, because it's a total different, and he said it just started last Tuesday, which is, I thought it started the week before, so that was kind of interesting. Just FYI, that was interesting to learn that. He said that, and then he said that the number that have been unemployed is greater than all the jobs that have been added in the last 5 years in Oregon.
yes, that's that's what we're dealing with. So
Okay.
it's a critical situation. If you're either going through your savings or you don't have any savings, you filed for unemployment, you're not hearing back. Yeah, there's a lot of people out there that are really struggling.
Yeah,
So.
we hear from all of them. I mean,
Yeah, I know. Well,
personal care people yesterday, and
so maybe we take a break now on childcare, before childcare, and come back in what, at 1:15, 25 minutes?
yeah, I need to eat something. So.
Okay, so we're going to adjourn now. We will return at 1:15. Childcare. Yes, we're reconvening our afternoon session starting, unfortunately, at 1:20 for the Deschutes County Board of Commissioners, and we're at point number 3, the child care industry, which has been added onto our agenda. Is Nathan available?
Yes, Commissioner Adair, and
Oh.
I am here.
Thank you, Nathan. You are good.
Okay, well, good afternoon, commissioners and staff. We're here on this topic to discuss a needed support mechanism or a request to support emergency child care assistance for up to 40 star-rated child care facilities in Deschutes County that are operating as emergency child care centers. At this time, they are operating at well under capacity, which is a financial burden. And then with the expected changes in the child care requirements with reopening, likely will be a continued financial burden. There is CARES funding available to support these providers. However, the application period just opened, and probably it could be a situation where it could either be too little or too late of funding to keep some of these afloat and operating within a margin to be successful and to be open so that we can get the economy back to work. They, as you know, and you've said before, we do have a significant deficit in available childcare in the region. So this is a high priority, and this came to us via the City of Bend and Neighbor Impact through our recovery efforts as we starting to devote some attention to recovery efforts from COVID-19. And we wanted to bring this before you as we were not authorized to spend the requested amount. So we wanted to bring this to you for your thoughts and consideration of providing emergency funding of $200,000 to Neighbor Impact to support this program. This is a potential cost share agreement with the City of Bend, as well as when we're reviewing potential funding. This appears to be an eligible expense potentially that we could recoup some costs from if those funds are made available to local governments, as this is a second order effect due to COVID-19 and a necessary response. So with that, I would like to invite, we have Carolyn Egan from the City of Bend and Karen Prowl from Neighbor Impact. And if you'd like to hear from them, we'd be happy to have them speak from the perspective of their organizations.
Nathan, who's going to recoup this funding? Who might we expect?
Oh, go ahead.
No, I just wondered, is it coming from the federal government? Is it coming from the state if we were to be paid back?
So the City of Bend is anticipating using at least some of their CARES dollars to support this program to pay us back. And then I've talked with James Wood from Finance, and he's investigating how to request reimbursement through the CARES program when those funds become available. I believe Carolyn may have a better grasp of the CARES dollars for the child care issue. So I might let Carolyn talk to you a little bit about that, if that's okay.
That'd be great. Thank you so much. Thank you, Carolyn.
Carolyn, you need to unmute.
Did we lose our screens?
Yes, sir.
Good afternoon, commissioners. Are we good?
Yes, there you are.
Okay.
Good afternoon.
Good afternoon, commissioners. I'm Carolyn Egan, and just for the record, I serve as the City of Bend's Economic Development Director. Thank you, Nathan. The introduction was absolutely fantastic. What we have been learning through our investigation of the CARES Act, is that these would absolutely be the types of costs that would be considered for be an emergency, an extra expense that we had due to COVID-19 losses, and should be able to be reimbursed both through the city and eventual allocation from the CARES Act. So it's really absolutely an emergency situation. We know that we need childcare for the first responders now. We know that we'll need childcare to reopen the economy at any level. And without these 40 providers, let alone the other 200 plus we have throughout the county, it just won't happen. So it looks to us, based on our reading of the Treasury guidance on the CARES Act funding that ought to be coming through Oregon to the local jurisdictions, that this would be an expense that could be identified and then reimbursed in some fashion. I hesitate to use the word reimbursed just because I don't want to get crosswise with the Treasury guidance, but I think one thing we've been talking about is we could acknowledge it as though it was a grant to those businesses, and then it should be okay to be covered.
Well, Carolyn, this is Phil Henderson. That's been a big dispute with the governor's office, whether or not she's going to give any money to local government, city or county. And Congressman Walden just put out a letter yesterday explaining that he thinks that's exactly what she's supposed to do, and that's what Governor Inslee's done and what the governor of Idaho have done. But that hasn't been clarified that they're really going to do that, because they have their own shortfalls. I agree with you from what I've seen from the federal rules that it does fit exactly within what the kinds of things we should be able to get reimbursed as a additional expense, not a decrease of revenues. But it's going to be really interesting to see what the governor does actually allocate to cities and counties.
We're watching it just like you are.
Okay.
So, Carolyn, you may or may not be the one, but star-rated facilities, is there any definition on that we could understand better?
Karen would be a better person to answer that question so that I don't mess it up on her.
And then it was mentioned a partnership with the City of Bend. So this is a $200,000 ask. Is that a $200,000 pool to be split between two large local governments, or what's the vision here?
Absolutely. We want to be able to cost share. And honestly, if we had an emergency way to have gotten this directly to Neighbor Impact, we probably would have looked to our way to do that. I'm sorry, I'm stumbling. But it's the county under the emergency order that sort of has the quickest way to get the money, and that's the problem right now with timing. So we absolutely intend to come back with 50% at least in cost sharing.
And then, reimbursement from the CARES Act through the state is kind of unknown at this time, though. It kind of needs to be negotiated or
clarified.
The future, yeah. That's just going to be interesting.
What is James Woods going to find out? Maybe he's called someone in Salem today.
Yep.
One thing I can share is that we've been working really closely with the League of Oregon Cities through our lobbyists, who you are all familiar with, Eric Kanzler, and have just been driving at to make sure that we're clear from the local government side all the way up to the governor's office. And I feel like we're making progress. I may be a little bit more positive than what Commissioner Henderson expressed on this working out okay for us at the local level through the governor's office eventually. But Karen, can you talk to Commissioner DeBone's first question about the star rating?
Certainly. So with star-rated programs, those are our local programs that have gone through SPARK, which is Oregon's Quality Rating and Improvement System. And they've put quite a bit of energy and effort into increasing their education, increasing the quality of their program. They've been a part of our local childcare networks, And they've proven to an outside expert, which is the Research Institute at Western Oregon University, that they are either at a 3, a 4, or a 5-star rating. So they have to implement best practice and be able to prove that in a portfolio that they submit to the state. And all of that is a great deal of work and shows a great deal of commitment to the field and to our community.
Great, thank you.
What, with regard to that, so there, Carolyn mentioned there's another 200 child care centers that I guess aren't star rated. What, is there any issue there that you're giving, you want to give money to 40 but not the other 200, or what makes the 40 the emergency providers and
the distinction, Commissioner Henderson, is the license. So when the governor's order came down to close childcare, those that were allowed to stay open had to get an emergency childcare license. So it is the 40 with emergency childcare licenses right now that are providing the childcare to the first responders and other essential workers. And those are the ones who are operating at those low enrollment levels. So they may have permission to provide for 10 kids, but they're only having 3 or 7 perhaps show up every day. And that's what families are paying for. So they're not able to meet their operating expenses month to month. So they have a special emergency license, and that's why there's a smaller number of them than normally would be operating.
And do you know if we had a pretty long conversation with Katie Brooks a couple weeks ago about the very restrictive guidelines that the governor's office had come up with about ratios between adults and kids, and how has there been any give back on that from the governor's office to make those a little more flexible going forward? So if child care is opened up, those will be more likely to succeed?
We have not seen the revised sector guidelines for childcare yet. I do believe that the feedback the governor's office received on those ratios was pretty much statewide. So I think that we would be hopeful that those guidelines would have been modified based on from the draft that we saw. But absolutely, it cannot be understated how difficult from a financial standpoint it will be for all of our childcare providers to operate under those original draft guidelines.
Yeah, okay. So where was this funding, is this the money we originally gave the EOC, or is this, what money was this talking about, the 200,000?
Commissioner Henderson, this is Nathan again. No, this is on top of the funding that was allocated to the EOC. That funding did not include this, and this is just a recent we just recently identified this need based on feedback from some of the sector sessions that the chamber and the cities have been working with, as well as just recognizing the deficit and the burden that's been placed on particularly those that have stayed open under this emergency guidance to keep childcare available for first responders, healthcare workers, and other folks that have to go to work. So especially in light of schools. So I think the concern is that these that have been operating under basically not meeting their operational costs are potentially at risk of losing these providers, and that would be add to an already identified deficit childcare. So this is on top of the funding that was allocated to the EOC for emergency operations.
So Tom, what would be the source of this funding?
Yes.
Well, we'd have to take it out of general fund reserves, out of our carryover.
And are we talking $100,000, half of this?
Well, I had a couple clarifying questions also, if I might ask.
Please.
So Nathan or Carolyn or Karen, I'm not sure which. So this would provide, it's only for the 40 star-rated centers, and there's $5,000 bridge grants that are mentioned in the report. So 40 times 5,000 is 200,000. So this would just be like an automatic grant to these 40, whether or not they request it.
It's actually, it says it's an application process, and the grants can range from $3,000 to $6,000 on the second page.
Why wouldn't everybody ask for 6?
Well, surely they would, wouldn't?
So I'll let Karen or Carolyn answer
They were
that, but there's
40,000 short.
some criteria that they would have to meet. So Carolyn or Karen, either one of you probably understand that.
I'll jump in, and then Karen, you can correct me if I misrepresent anything. For the 40 childcare providers who are operating under the emergency license, they fall into 2 different categories. They're centers and then home providers. And they have different ratios and different qualifications that they have to meet. So one would be a childcare provider who may be in your neighborhood, and then another would be something that looks more like Growing Tree, for example. And what we imagine is that based on needs, so not all of the 40 childcare providers that are open are not meeting their operational expenses, but there are some that are. But we wanted to make sure we got the universe as we presented the possible scenario to you all. And then depending on that certification, whether it's a small in-home care or a child care center, they would be able to apply for the $3,000 grant or the $6,000 grant. And then we really wanted to make sure we met the needs. So we didn't want to provide someone with $6,000 if they didn't need it, but if they truly need the $6,000, we wanted to make sure they had access to it. So this is a matter of keeping the lights on, keeping cleaning supplies available for the children who are in childcare right now, making sure there are meals for these children. So it's really, these are not in any kind of exorbitant expenses, but really just the basic ones that childcare providers have to meet on a monthly basis.
Okay, so however the math works out, I mean, the 200, it sounds like 200,000 would be essentially fronted by the county, and then the city of Bend would match, if you got CARES Act reimbursement, would match presumably only those centers within the city limits of Bend. So I'm not sure how many of these 40 are in Bend versus Redmond or elsewhere in the county, but so is that kind of how you envision the mechanics would work on this?
Karen, can you speak to the number that are inside the city limits versus inside the county, and then I'll answer the other questions so I have the right piece of information.
So I looked up just about every bit of information except that. So I have the breakdown of center versus family, the capacity they're currently serving, but I'll try to get that question out to someone and get a really quick answer.
And I would say, Tom, that our plan would be that we would come in and reimburse. We would put in 100,000.
Carolyn?
Wouldn't it be as easy?
Carolyn?
Yeah. Like
The city of Bend only is contributing $70,000 to the stabilization center, and that's a number we heard from 2 years ago, and they have never increased that funding. And you know how I think the stabilization center is going to be so important for the city of Bend and the whole community. So this makes me nervous when you're saying that they're going to do 100,000 when they actually didn't jump up from the 70,000 that Chief Porter committed to 2 years ago.
I understand that there's lots of different histories and pieces of this. One of the things that I can say in this regard is that childcare is one of the council goals right now, and I don't see them deviating from housing or childcare as a way that we support our community through the recovery and even as the situation that we're in right now. So that is the best assurance that I can give you right now.
Will you write it in blood or something,
I would. Yep. Can I?
Okay.
Well, even more than that, I think, basically, you would have to do at the city the same thing we have to do at the county, which is we just have different tax bases. So we go to all the taxpayers of Deschutes County, and we have a general fund, and we would pull money from there. The city needs to make the same decision. I mean, they have a city council meeting tonight. They could make that decision just like we're being asked to make the decision. I don't see the point of us funding money and then working on some arrangement to get it from the city. I mean, if it's I mean, this really came from city. The first I heard about it was from the mayor, and she explained it to me, which is good. But I think we do need to know kind of, and I like Tom's question of how many are in the city of the 40 and how many are outside, because we're spending all the county taxpayers' money on whatever we do here, so that's important for us to know.
One piece of clarification, the reason that the request is coming this way was I'm trying to think of the word, the quickness, the rapidness, the ease of transferring. Right now, the EOC has an open contract with Neighbor Impact, and it would be the easiest way to move the money from a public entity to Neighbor Impact so that we could get the grants out. That's the reason that the request is coming to the commission.
If you get the money to EOC, we'll make sure it gets to the Neighbor Impact. I guess that's how I feel.
So that was I want to just be very clear about that. That's the reason that the request is coming in this manner, was due to the ease of distribution of funds directly to Neighbor Impact, so that the dollars did get to the right providers in as quick a time as we could.
Is Karen going to be able to tell us how many are in the city of Bend? Is she working on that right now?
I am. I'm working on it right now, and I've sent it to my data expert, and she responded, "Please hold." I know she's working on it. Sorry for the delay.
No. I know it's like, well, either count up everybody that's not in the city of Bend, however the list looks like.
Yeah.
Sort and count.
Just as kind of an aside, Carolyn, one of my kind of beliefs here is that I get frustrated with the state of Oregon deciding they want certain goals and they achieve it the way they want to do it, and like they could open up the child care centers. I mean, they could already have done it. Some states have. They could do it tomorrow. They could do it today. They could do it whenever they want to do it, and they could do it at regulations that actually work for the child care centers, which would be great. And then the taxpayers wouldn't have to come up with ways of funding these private businesses. And it's just really frustrating. And this isn't the only way they do this. They do this with how they're going to do housing by and land use. They say, well, we're just going to make our cities more dense. That's ours. Or they, whatever. We're going to do subsidized housing. I just think here, it just seems to me that we should be really pushing on them to make reasonable rules for child care that make it possible to be profitable as a child care center. I know this is an immediate need and you're talking about, but it's still kind of connected to the bigger picture, which is...
I would say, Commissioner Henderson, we absolutely share, not just us at the City of Bend, but also all of the child care providers and the advocates across the region with that we truly believe that this is a full court press. So this is an immediate need that we're requesting action on, but it absolutely does not change our efforts to get the guidelines for reopening as clear and as practical as possible. It doesn't stop us from advocating with the state for them to release their $38 million that they've identified for childcare. It doesn't stop us looking for other resources to help fund childcare. This is one piece of the puzzle, and we're not taking our foot off the gas on any of those others at all right now. I mean, that we're spending considerable effort to meet exactly the goals that you've just stated and that you just stated.
That's great. Yeah. What we're getting at, another option would be to give a different amount and say that, if things don't open up, we come back and look at it again another week or two,
Yeah, well, we could always do half of it, and then we could say, let's see what Bend City Council does tonight. If they're willing to commit, then we'll feel more comfortable. Then if we know that they're going to reimburse us for $100,000 we can do the other 200, when our next meeting is, it's not till the following Wednesday?
Yeah, but these are businesses, so if they get an inflow of
Right.
1,000 or 1,500, that helps. And,
It helps.
And maybe
Keep
in a
them
week or
solvent.
two they get some more. But it may turn out we won't need to do that because she will open up the child care and make it more. I mean, once the economy gets better, I think more people have their kids in child care too, so that'll help. So.
One to that point, one of the things we're learning from the child care providers is that a lot of this opening for them or getting back to where they were in the beginning of March really is very closely related to school openings. And so unfortunately, more realistically, childcare getting back to full enrollment or full operation, for lack of a better word, probably happens in the fall when school reopens. My fingers are crossed because my 9-year-old is in the next room getting her homework done.
Wouldn't more kids be going to childcare with school closed? I mean, wouldn't that be the natural thing that parents would do?
Yes and no. It's really all over. What we're hearing from the providers is that if there's an older child home, they have not at this point chosen to take their younger child to childcare.
That makes sense.
And you can imagine that some childcare is being provided for the younger children because the older ones are at school. But with older children, even school and high school at home, the need for younger children going to childcare has just changed dramatically for families right now. So it will be a gradual return to childcare as the economy opens and as workers across all sectors return to work.
I know they were showing a camp in Sisters that was, reconfiguring what their program would be and how they'd had like 300 kids, but maybe now they're going to have smaller groups, and they were really hoping that they could open. When you look at the numbers, children are in the 0 range for COVID, and they really do, according to Dr. Atlas from Stanford, they really need their socialization. It's really important. So, yes, especially for 9-year-olds in the next room.
So it's a $200,000 ask that we're being asked to split, I think, with the city of Bend, and I'd like to go to half of that, which is $50,000, which would be an amount to step into. And it is all the citizens' tax dollars, general fund. There may be a reimbursement opportunity here, just like we were talking about for that other loan. Capital preservation would be the goal. It may be less than, and it could take years to come back too. I mean, that's the other thing. If it indecision happens all up and down the chain. We'll see how long it takes.
So you said 50,000?
Yeah.
You just want to commit to 50,000
today? Yeah.
Today.
Yeah, not on that, but just a clarifying question for Nathan. If hypothetically the CARES Act funding doesn't come through, would this be a potential reimbursement through FEMA, through our EOC?
Would it?
So I think that probably not, although we could potentially look at some of the other federal programs that, like Health and Human Services and some of those other programs, we can research that. And again, I certainly didn't want to lead it astray when I talked about the CARES funding. Again, that was a hypothetical. Obviously, anytime we spend money, we have to treat it as we're not getting it back. And I know you appreciate that and get that. So I think the reality of it is that this is based on the CARES funding, the stuff we've all seen. It is eligible if those funds get cut loose from the state to the local governments. But as you mentioned, we should spend money as we're not getting it back, and then work diligently to recover it.
So did you make a motion then for?
I move $50,000 commitment at this time to the child care industry assistance.
And from the Deschutes County is what you're making, and a request that the city join us with a $50,000 from their general fund.
The city could join with 150 if they'd like, but yeah.
If they have 75% of the child care.
Yeah.
Yes, that's why we're waiting for the number on the
Right.
number of child.
I'm just thinking.
Yeah.
I mean, I heard you both kind of say, well, there's some number here maybe, so I just started with the 50,000.
Actually it's a big
Yeah,
number.
it is.
When you think that we
because
only
there's-
gave 73,000 for the grant funding for businesses, that had the match of 67,000. So, yeah, we're talking
Well, this is,
While we're waiting, Carolyn, I don't know anything about how you get things on the agenda, but will it be on the agenda tonight at the city council meeting?
To my knowledge, it's not on the on the council agenda for tonight, but we can have either through the city manager report or through one of the councilor reports asked to have it brought forward.
Could you please? That would be good.
I will absolutely ask. Yes, for sure.
Thank you. So,
The update on our number is that our NACRWare database at the state is currently experiencing technical difficulties.
shock.
Which is why our amazing data person, Jessica, is having a difficult time pulling the number, and she apologizes. And I can get that to you as soon as she sends it my way.
Do you know them well enough that, like, by addresses, you could kind of tell how many might be in the city or just rough numbers versus the rest of the county?
Yeah, majority of these are in the city of Bend. There's a small number, so she's going to be, that was her next thing. She was going to move to just doing a data pull from a different spot within our system.
Is it possible to do like a crazy motion of, we will cover the percentage that's outside the city of Bend, and Bend, if it's like 75%, then the city of Bend can pick up that portion of the 200,000? Because that would still leave us like at 50,000 if it's really 75% in Bend. I don't know if it's that many or not.
Well, I think that's possible as a motion. I guess I personally, city residents are also county residents, so I'm okay with doing half of whatever. I think it's, but if I am kind of, there's as many people live out of Bend as live in Bend, and so I'm kind of surprised that the daycare population may be more centralized.
The location of the child care provider does not dictate who's using that child care. So just because child care providers are inside the city limit, the spots at those child care facilities are not at all limited to only children of residents of the city of Bend. So they're serving, just as you know, your county facility is in the city of Bend. So you have workers coming from Lapine and sisters working for the city of, or working for Deschutes County who may have child care in Bend, but they're residents of other parts of the county. So I just wanted to make sure when we talk about serving families, we're serving families from the entire county, not just Bend City residents. Thank you.
Are we considered a star child care provider, the Deschutes County?
That's awarded to the providers, not to the...
we have a facility in our building.
We host a child care. So I just wondered if it was a star or not. Okay. So, well, do you want to make, so we have a motion for what, 50,000?
Yeah, I'd support that motion, and with the amendment that we also request the city of Bend, our partner, to do 50,000 as well, and make that commitment tonight.
Okay. Okay, that's a friendly amendment?
It's a friendly amendment.
Will you accept that friendly amendment?
I'd be hesitant to set the number because that may limit what they would do. Because then they might do 100.
Oh, no, just
At
that
least.
they make a request for at least 50,000.
Yeah, however, yeah.
My feeling is that
Or
things.
Sharon's got to type this now.
Sharon?
I support City of Bend partnering with us, a statement like that.
Okay. Any further discussion? Mr. DeBonne?
Yes.
Mr. Henderson?
I vote yes.
And the chair votes yes.
So, I expect we would bring this back next week to kind of find out for sure what's happened in the city with the distribution, and if you are willing to entertain the idea of an additional 50 to come up with a full match.
Yeah, we could visit, in my opinion, we could visit weekly. I think a couple of things. One is other businesses may be open by then. The governor may be more clear on the CARES Act. I think she's going to be put in a position where she's going to have to say, we're giving this much to cities and counties. I think she's going to have to do that.
I know the governor of Washington State was actually sending money out to counties.
Already.
Yes.
Yeah.
It was, well, it might have been the 11th, but I know it was definitely, there was a date promised to
Yeah.
the counties of Washington.
Well, I think this is all discretionary at that level. I mean, she literally could decide, I'm gonna give this much to this entity. I mean, there's kind of no rules in a way, as long as the legislature doesn't counter it, so. Okay.
Great. Thank you very much.
Well, thank you for including us, and hopefully it does some help, and
Yes.
Thank you.
Thank you.
Thank you.
And please come back, because it could actually, we could get funding, and we could know that we're getting funding, so.
I think that's my clarifying point, is just that it is the quickest way to get the money to the providers is through the county and the relationship with neighbor impact. So I don't want the city to muck that up in any way. So we'll continue to stay in touch about how that works best, and we'll take the lead from our finance professionals to tell us how to do that. So thank you so much, commissioners. I really appreciate your time this afternoon.
thank you.
Thank you. Okay, Nathan, you're now on for the housing shelter order.
Yeah, I'm pulling that order up in front of me
I
here.
don't think I have that order.
I have
here.
2 copies of it.
And did you end up making the changes that I put in your box? It looked like, I think I looked at a copy of it, and it looked good. I think those made it a little more clear.
Yeah, I believe the changes that you indicated, Commissioner Henderson, have been made in the latest copy.
I think you should just make 2 copies of everything, Patty, and then I could just say, I don't have my copy.
Well, actually,
Do you have it
I
or
only
not?
have one. It's this one.
What's it? Maybe I have it here. Let's just see.
See, it says on the outside, the childcare one, it said COVID-19, but it was really childcare.
Oh, there you go. Is this your copy?
I have a red line version, so.
Okay.
Okay. I know. How do I end up with so many copies?
Do you want the red line version?
Sure. After I looked at it yesterday, I was good with what we had, so if that's what we're talking about, it's good with me.
I have the original that we worked on.
Okay, yeah, and then Tom had put one in my box, showing how he'd made those changes, and so I looked at that. Okay,
Great. So,
my only
Nathan, what happened to our screen? We lost our screen again.
Well, he's just on audio. There you go.
Oh, Nathan, where are you?
Oh, here, I'll show my face. I apologize.
Well, don't
Got
apologize.
the technology
just
working.
doesn't want to show the beach behind him.
Yeah, where are you at?
See, now
Palm
it's dark
trees,
anyways.
beach. Yeah.
Yeah, I wish. No, I'm not so fortunate yet. So
question, this is something that may or may not be triggered, or I mean, as in, we can stand by if we don't have cases like this, but at some point it gets triggered. What does that scenario look like?
Okay, so this is kind of a one piece of a multi-piece puzzle here. This public health order is an administrative order to identify the need that due to the COVID-19 pandemic, that we need to have the ability to do non-congregate sheltering. So non-congregate sheltering, as opposed to congregate sheltering, which is everybody in one big room, or like the typical warming shelter or a fire evacuation shelter, is obviously of concern during a pandemic. So that we need to be able to have non-congregate sheltering to take care of our community members. And so this order identifies that is a need based on the public health situation, and allows us to then attach this public order to a waiver that the state will send to FEMA Region 10, basically waiving or allowing us to submit reimbursement to FEMA under the Public Assistance Program for any costs associated with non-congregate sheltering. So that's kind of the function of this process: A, to identify the need, but B, to then ultimately support a request to FEMA for that waiver. The process, and I believe I have Chris Weiler on, and I can speak to a little bit of it. Maybe Chris isn't. Oh, I think he is on. But essentially, the hotel situation is that currently we have an agreement with Neighbor Impact that we need, and we're in negotiations with a local hotel to create a master lease agreement. And that lease agreement allows the county to maintain control, but then allow Neighbor Impact to shelter high-risk populations in that hotel. If at which a time we need to put somebody who's unhoused and COVID positive, that provides us of an option to do that, which is a requirement or a prerequisite under the governor's reopening plan. So this allows us to both meet that criteria, but also to best serve our members of community and try to limit the spread of infection.
So what's the scenario that it gets triggered? As in, this is the paperwork part of it, and the reality is, you know, if we have one case, or if we go to the second and third case, or 10 cases, or is it just going to be, we're going to go sign the contract now and have it stand by? That's what I'm not clear on.
Yeah, so we would sign the contract, Neighbor Impact, and I'll let Chris talk about the financial piece, because that gets a little dicey and he's got a better handle on it because he was heavily involved in that. But essentially, Neighbor Impact would pay for the lease of the hotel because they'd be sheltering high-risk populations in there. We have a plan in place to be able to put a COVID positive person in another portion of the building and provide for that. At some point, we would have to weigh whether the risk is too great. We would have to move those other folks out. So the cost associated with the hotel plan is, for the county, is really a worst case scenario, not a likely scenario.
So it's a 23
Still
room?
not clear.
Yeah, me neither.
Well, so is somebody renting a room right now, today?
No.
We are.
So, Nathan, if you don't mind, I can.
Yeah, go ahead, Chris.
Interject. So, this is actually a mutually beneficial situation between Neighbor Impact and the county. Neighbor Impact does not need the county to place homeless folks in motels. But in this situation, with the COVID situation, there are liability concerns that they didn't have to experience before in placing somebody that's homeless in a motel. So through a partnership between both entities, it's actually a great win-win, because Neighbor Impact has money. They will lease out an entire motel at their cost. They will place homeless people like they normally do. And when the hospital calls, or Mosaic Medical finds somebody at a homeless camp that they identify as COVID positive or symptomatic, and they're homeless and they need to be sheltered, Neighbor Impact is working with us to allow us to use the rooms. So the good news is the rooms are going to be used regardless. But on the off chance we get somebody that fits the criteria that needs to be isolated, in this partnership, we have a mechanism today, well, not today because the agreements are not signed, but when they're signed, to take somebody and transport them appropriately to the motel and isolate them for up to 14 days.
So when we sign this document, the contract's going to be executed by Neighbor Impact to lease a whole hotel.
So we're basically holding the master lease with the idea that Neighbor Impact will reimburse us for the rent.
So I just want to be clear about something, that from the beginning of this, I've never favored us just going out and leasing a hotel for 3 months thinking we may have a patient. We specifically asked, I think it was Dr. Conway, have we had any homeless people yet with a COVID case? And the answer was no. This was about a week ago. Then I said, have we had anybody that we've had of any kind that we've rented a room for? The answer was no. So are you saying that right now the Neighbor Impact has a whole hotel full of homeless people that they always have that? I don't know that.
No, that's not what I'm saying. I'm saying they are experts at trying to assist the homeless, and they use motels and hotels in Deschutes County and haven't had an issue with it.
So how many are in
They do have an
hotels
issue.
right now through Neighbor Impact?
You know, I don't know. I know they have a waiting list of about 40 people, is my understanding. So that where the issue is if a homeless person is actually COVID positive, and from the EOC standpoint, we're laser focused on the public health part of this. If the hospital calls and says, and we've been very lucky because the hospital has identified at least 3 people that I know of that they felt were potentially, they were symptomatic and they were tested, but they left the hospital. And had they been positive, luckily they came back negative, they would have asked us for assistance to place that person in some.
Right. Well, that maybe we were lucky or they were lucky or whatever, but the point is that we're seeing since early April, we've seen a decreasing number of cases of COVID-19 in the county, and with increased testing. So that means you'd think with increased testing, if it was even staying steady as a disease, that we would be seeing more cases. So if we haven't had anybody yet, and we don't have anybody currently rooms, this has always been the question I've had, and I've never had a very clear answer, is are we saying we're going to go rent a motel tomorrow or next Monday or whatever? And it sounds like you're saying we are. And you may be saying that Neighbor Impact is doing it and we're going to just pay them back, but I've never been in favor of that. And I think I don't know if the other commissioners are or not, but it doesn't make sense to me.
Can I, this is Nathan, I apologize. It's a little awkward on this. I would like to address, the one issue is signing this order is not, does not constitute signing an agreement with the hotel. This is nothing more than saying that there is a need to be able to provide this service if we have a COVID positive, and it allows us to get potentially 75% reimbursed by FEMA under the public assistance program. The second piece of that is the hotel or master lease agreement that it being looked at, and that cost is Neighbor Impact would front the cost, would pay for the building of the hotel. We would just be able to have access to that facility to shelter a COVID positive person. So that's how this is really a win-win. So Neighbor Impact has, when we came in March seeking funds, one of the things we sought funds for was to be able to have some resources to shelter homeless that are either high risk and or COVID positive. Neighbor Impact has ultimately, with their funding through another program, has been able to meet that need for our community at thus far no cost to the county.
So why are we the master leaseholder? If they're doing the deal, they should be the master leaseholder and we should be a subtenant.
But we're the ones who can get the FEMA reimbursement, correct? Isn't that what this situation is?
So one of the number one problems that we've run into, regardless of which motel we've spoken to, is how to handle liability issues associated with COVID. And Dave Doyle and John Larity from County Legal have been intimately involved in the range of requests from the hotels to address the unknown issues that could arise at some point legally by housing somebody that's COVID positive in a motel. In particular, if we do it in a motel, we don't actually take over the motel, and another guest that actually stays in the motel in some way crosses paths with this person that we place. There are liability issues that are generated by virtue of the fact that we're not taking control of the entire space. So we've approached this in a way where we've worked with our legal team and asked what's the best way to mitigate our liability. And then we presented that information to Tom and Eric and received really good measured guidance to limit the liability associated with the county and sharing liability with neighbor impact. And Dave can speak to the terms and conditions of what that looks like. But the liability issue is why the county is involved in this, because what could happen with somebody that's COVID positive in a motel, there could be some potential litigation.
Yeah, I mean, I'd like to communicate with Neighbor Impact a little bit about this. I mean, I know a lot of the folks there and the director, and I was on that board for many years, and it's just the scenario that it looks like from Neighbor Impact's point of view, I'm not clear. Yeah, I mean, it kind of boils down to how many rooms do they rent regularly and what's the purpose and where are those funds from? Because if those are federal dollars supporting homeless needs, but we're really trying to get it reimbursed during a emergency situation and with other federal dollars, you know, it just leaves questions around it.
Yeah. Commissioner DeBone, I can speak to that. So if Neighbor Impact's using federal dollars, obviously we can't double dip that. Chris, Neighbor Impact, the facility we're looking at would likely be able to probably fill it based on their waiting list population to serve.
Well, and then, yeah, what kind of funds do they have? Yeah, so as I say, now I'd like to look into that a little bit more. Another question, though, another whole topic. The last point, item number 3 on the order itself talks about the order will remain in effect until further notice, but shall not exceed beyond the duration of the public health emergency. And that kind of brings up the concept of what would be the guiding document for that, as in if the state order of emergency declaration or the county order of emergency declaration. Ours is was put in place for 60 days, 50-something days ago or 50 days ago now, so that's the discussion coming up. The governor had just extended the state emergency orders till July 6th. So, yeah. And maybe that's for us to decide. I don't know that anybody wants to make a decision on that, but I'd like to map it to something more specific than just the duration of the public health emergency.
I thought, actually, does this not really?
Or maybe it's federal.
Yeah. Item number 4, though, the isolation facilities, this is like a requirement of our plan, is it not? That we've developed a plan to shelter unhoused populations. We're working with Neighborhood Impact. That's in our, that was in our document. I mean, I'm looking at the wrong copy, but that is one of the requirements from the state.
Yes.
So.
What does it say? I thought this is a scenario that would get triggered if there was an outbreak, in unhoused people populations, not we're going to go get it for 3 months. And, as I say, the scenario sounds different than it did originally.
And I'm with Commissioner DeBone on that. My understanding all along has been that it would be triggered when needed, not that we were in. And I'm really kind of lost on why, if Neighbor Impact can fill a motel now, why don't they? So why do they need our order to do this? I mean, again, and I'm not in favor of renting a facility for 3 months.
So the Neighbor Impact has money to lease out the motel to shelter homeless people. What they are not able to do without our cooperation is shelter a homeless person that's COVID positive. Yeah. And the mission of the EOC has been to make sure that there's a stopgap. There is a place for somebody that's unhoused to be able to properly shelter if they're identified as either symptomatic or COVID positive. And the real scenario will be, and like I had mentioned earlier, we were waiting for the hospital to have a situation where they identify somebody that is COVID positive. They don't have a place to stay to properly isolate because they're homeless. Or Mosaic Medical is working in the homeless camps and with additional testing identifies somebody that needs to isolate. What we don't want to have is no option to place somebody. So by working with Neighbor Impact, we're creating a situation where they're going to pay for the facility because they're going to use it. But when we call them and say the hospital gave us somebody that is COVID positive, they're working with us on a plan to allow for space so that we can go ahead and shelter the person. So we're creating basically capacity in this agreement. If we never use it, there's no money involved for the county for the most part. I mean, really the Neighbor Impact is paying the upfront and total cost of the base rent to rent out a motel, regardless.
Well, and yeah, so I need there's another phone call or two I need to make offline because, as I say, I mean, the history of Deschutes County stepping into something like this, and not to be negative, but we already bought a motel, and that's where Bethlehem Inn is now. And as I say, that's just the history of us trying to do the right thing and taking over a whole facility like this.
But,
and we're, yeah.
Chris, I have a question then. Let's say, so they have homeless people in it, the 20-some rooms, and then we have that positive COVID, so all those homeless people will have to leave, and then we will take over. Is that what you're saying?
No, so part of it is just pre-planning. So we would pre-position which parts of the hotel, upstairs, downstairs, the north end, the south end, because there's different buildings. And we would basically compartmentalize the how we would use the motel. So planning for somebody is going to come tomorrow or in a week from now and need a place to stay and they're COVID positive. So we will be making efforts in collaboration with Neighboring Impact to just make sure that we can place somebody but not put them in harm's way around everybody else. That's part of the planning that's happening right now.
And it is a request.
As I say, I would request, I can make a phone call or two offline and get clear here, but I need to understand this.
Okay.
Yeah, I'm good with that.
So, and maybe, I mean, if we get back together for the other document tomorrow or the next day or something, we may be able to get this done.
Okay.
And yeah.
I guess I'd like to see we've heard this reference to there's an agreement being worked on between the hotel and Neighbor Impact, and then I don't think we really have seen that. It'd be nice to see where they're headed with that. So.
I can do my homework on it. And I do apologize, gentlemen. I mean, but yeah, all of a sudden I'm just like, oh, wait a minute.
So is it possible for us to see the underlying document then with Neighbor Impact? Has our legal seen that document?
Commissioner, yeah, Dave Doyle here. We've been working on it for quite a while. I can forward both the draft agreement with the motel as well as the draft agreement with Neighbor Impact to the board's attention. Those were just finalized yesterday and the day before. And when I say finalized, they're basically version 5 working drafts. So they're not final yet, but they're relatively final working drafts. Obviously, nothing's been committed or obligated to. And yeah, we can push those out to all three of the commissioners right away. I do want to underscore something Nathan said, and that is the order before you does not in any way commit the county to these agreements with either the motel or Neighbor Impact for the funding stream. So, and I do think those can operate independent of one another, and legal certainly doesn't see any reason to not go forward with the order today, which at least resolves that piece, because it simply says that this would authorize the use of lodging facilities to place homeless folks that are suspected of having COVID. It doesn't obligate us to actually do it. It says that we would have the ability to do it and then potentially be able to utilize this as a mechanism to get some reimbursements, depending upon the source of the dollars that are paying for it. I do think some of the Neighbor Impact money is federal sourced, so whether that would preclude some sort of a reimbursement if we did house a COVID person there, I'm not totally sure.
Well, Dave, is there a reason we haven't seen a draft of this over the last month and a half? I mean, we've been talking about it forever, but we've never really been briefed on what you're doing with all of the parties. And I guess I never had understood we'd have a master lease that, so.
Well, yeah, both documents are actually drafted for the county administrator's signature. We have been working closely with health, with Nathan, and also county administration. So if there was a failure for pushing it out to the commissioners, I'll take responsibility for that. I should have pushed that out to you folks yesterday or Monday as these versions were getting a little more pulled together. The first handful of versions were extremely rough and you know, just short of back of cocktail napkin type stuff. So I wouldn't burden you pushing that out to you. But certainly what's existing right now is something that can be pushed out. And like I say, I'll take responsibility for failing to do that. I will push those out to all three of you immediately.
Well, and I would acknowledge I haven't had any bandwidth to even really think through this. I mean, right now is the moment I'm thinking, okay, well, I assumed it was going to be something that would be triggered just in case, and now it's more like neighbor impact will rent the whole thing, and we might use a room, and that's I haven't been able to think through that. I just haven't even been able to. So I don't. If you would have sent it to me, I might not have been able to get to it. So it's just where we're at right now.
Okay, so we're very clear that we're not done working on this, I believe. So we need to see that underlying agreement.
And I mean, if it's a requested item that's timely, or if our draft plan depends on it, let's schedule a meeting to follow up tomorrow or the next day, you know, because if this is a dependency item, I don't want to belabor it. I just don't have the information I need right here.
Were we attaching this document, this signed order, to our plan? We aren't, are we not? Okay.
We're not. No, it wasn't going to be an attachment.
It wasn't a requirement.
There is kind of definitive language in prerequisite number 4,
Right.
The new green text that talks about, I mean, it says has secured hotel rooms, well, for first responders. I guess it is working on, with Neighbor Impact on a contract for unhoused, and has developed a plan, doesn't reference a specific signed agreement.
We'll get there.
Okay. Thank you very much. I know we did work on it last Wednesday. We worked on it today. We're getting closer. All right, so item number 5, short-term rental order. Dave, are you going to address that?
I certainly can. I wasn't intending to, but
Well, is someone else going to address it? Tom, were you?
I think that the issue, the commissioner had asked that this be put on the agenda for today, and it's not set to expire until May 15th, so,
Right.
which is a week from Friday. But I think the commissioners were interested in kind of providing some direction on what the intent might be relative to the May 15th termination, you know, whether you would like it to come back for a consideration of extension, or if you just want to let it expire on the 15th, I think was our direction.
Okay, yes. Ask for it to be put on the agenda.
Madam Chair.
Yes.
I'd like to start off with my email chain that I accidentally kicked off yesterday. So we got a lot of input on this. I think we saw probably the property operators must have sent an email to the owners, because we got emails from all over the place. And I was processing some, and at one point I decided, okay, you know, this person specifically I want to communicate with. So I wrote a paragraph back, but I CC'd board@deschutes.org, which kicked off, you know, you as other commissioners kind of knowing my thoughts on this. So, and then I said, oops, I didn't mean to do that. And, you know, Dave, just our legal counsel, I talked to him. He mentioned, just put it in the record. So as I say, it could be construed as a public meeting if somebody really wanted to, ride us on that, because I shared my thoughts, which you were able to see in email. So that's all I'm doing, is acknowledging it. I can put the email, I printed a page out in our minutes. You know, I'll give it to Sharon to put in the minutes. So definitely not intended to do that.
Thank you, Commissioner.
But then there was about 6 people that he had sent it to, and board at Deschutes.org was CC. So then we kept getting everybody's comments on his email. So I do apologize for that.
It made for yesterday a very exciting.
Well, yeah, I
Well,
propagated
and
the
I think
email.
that's just an unclear issue because they get circulated. Lots of people write to the board, and then
Yeah.
one of us may respond, but then they respond to the board, so it becomes.
Well,
it may not be us sharing it. It may, other people.
But
Citizens share with with board members what other board members think. Because,
Yeah.
But really, that's the intent of the public meeting. Is we're not deciding things outside meetings.
Well, but I
and we're
clearly
not
stated-
gathering, and we're not making decisions.
I clearly stated my opinion in that email. That's why it's pretty clear. So I said, I support letting the ban expire on May 15th to this one person. So that, I mean, yeah, so you hadn't seen that specifically. But I also say the next issue is the governor's ban on non-essential travel. So really, and this is, now it gets to our conversation about this topic. Having a short-term rental ban expire, but having a state order in place that says no essential travel, that's the status we would be in. So as I say, people are watching and very much interested in this topic.
Well, I think
right
the
now.
reason to make a decision today about what we're going to do on the 15th is because people that have short-term rentals want to be able to advertise them
Yeah.
for rental next weekend.
Yep.
And if we don't give them indication today and wait till next Wednesday, they only have 2 days. And are you trying to say that we can open it up, but you're also in favor of not lifting non-essential travel?
Well-
Because that's who will come rent these, is people that don't, so that's, I don't think, and we don't have a say on the travel ban that the governor's put in place.
Couple things. As I say, I do support letting this short-term rental ban expire. So that's one commissioner's position. I do, in our document, our opening plan, it says we do not promote tourism at this time. There's a sentence or two in there. So that's the first step of our plan. And then if we think of it in phases, which I was trying to do, which everybody's kind of not following very specifically anymore, the vision was a phase 1 opening stabilized for a 2-week period so we can have the discussion about what phase 2 or phase 3 might look like. So that is what I was working on previously. If there isn't a definition between a phase 1 or a phase 2 opening, that's where we need to put some clarity around what does it mean to be a tourist coming to Central Oregon from, Seattle, Portland, San Francisco, and what is our position on that? And do we want to take a hard position or leave it up to non-essential travels orders at the state level?
Well, I actually spoke to someone who misinterpreted our original edict and thought they were owners of their house and they didn't think they could come and stay in their own house. And I go, no, that edict never meant to exclude you from coming to stay in your own house. You pay property taxes on it. You should be allowed to come to your own house. So I was, sad but happy to be able to clarify that to someone.
So I don't, we've just about adopted a plan that really recommends reopening most parts of our economy locally, which is not consistent with the phased plan that we'd heard from the governor a 3 weeks ago. We don't know where she is now. She could do that. Other states have done that, and she could do that, and there's probably pressure on her to do that from a lot of people. So we're no longer in a phased approach from our point of view. If we open the short-term rentals, which I'm inclined to be in favor of, because I think just like people not having income, there's people that count on their rentals as what that happens to be a business, just like everything else that's in business. It's the way people they've been shut down for 6 weeks, and I had always thought we should be open by Memorial Day because that's a big weekend for people to travel, but there's really no way to open short-term rentals. I mean, I guess we could, but it seems inconsistent to say we're opening those, but we're going to discourage travel. Because that's who rents them. I mean, locals don't go out and rent the houses and too much.
Sometimes they do, actually. I know.
Well, I bet it's less than 10%.
Well, probably it's a small number, but, you know,
But I don't think do you think that's what the short-term rental owners are hoping for? Is that more Bendites go to Sun River for the weekend? I mean, I think they're hoping for more people from other places come here.
Well, in a conversation with the operator yesterday saying that when somebody leaves, they let the property sit for 24 hours before the cleaning crew even comes in. So that's, separating that physical activity and hopefully letting anything that might be there fade away or whatever. And then, very much a cleaning protocol, which is more expensive and there's more overhead associated with more rigorous cleaning. So, I mean, there's some good things happening also.
I know, my
Well, I
house
agree
has
with
never been cleaner. No, yes, I mean, really, it's all these things you're cleaning with, and that's.
My hands have never been drier, I can say that.
That's for sure. And then I also made a copy and put in your box yesterday with the Sun River Lodge, the resort, and the fact that they're opening up on the 15th also, and they have put an incredible amount of thought into their sanitation, their safety, and all the procedures. Yeah, exactly, like you just said, the 24-hour rest period, no shared spaces, people are using guidelines, cleaning guidelines, disinfectant sprays, all those things.
Yeah, so, I mean, as I say, I do support letting the ban expire, but I don't know how to temper the excitement about wanting to come here from all parts of wherever and renting houses and having full occupancy all summer long, and if we should be opposing that or not. That's the dynamic that's awkward.
Do we have a copy of the order that we're looking at? I didn't.
Do we?
I don't think it was in.
It wasn't in our
the
packet.
Yeah.
Well, it's just our order set to expire, so yeah, I don't think I printed it either.
I just wanted to check on the wording. So it will expire on its own on the 15th, so all we could do
Yeah.
today is give an indication that we
Right.
don't intend to extend it.
I think that's, when you talk
Is that it?
about people that own these businesses, and they have to pay their mortgage.
Oh, yeah.
It's a downward spiral when people can't pay their rent, and then you can't pay your mortgage, and things just really get way out of line. The world is incredibly out of balance, and hopefully just not extending the short term will give a little more balance to a lot of people who have a lot of assets invested in our county.
Well, as I say, I do support that. I think it's the Executive Order 2012 Outdoor Recreation and Travel section, item number 22.
2017, I think. 2017 is the order that prohibited short-term lodging.
Oh, yeah. I'm referring to
We
the,
amended it with 2021.
yeah.
So I'm built houses in Sun River and Caldera that are rented that way, and in Eagle Crest. So and we've heard from a lot of people that point out the fact that they do contribute to the economy. These are their property, and so I'm in favor of letting it expire at this time. Don't think it was a prohibition of short-term lodging. And we had passed it on April 1st, so it was basically in effect for 6 weeks.
And the other thing that we have to think about too is the fact that the city of Bend only advised, whereas we actually shut it down. So a lot of people that wanted to come here actually went to the city of Bend, and that made them a winner, and it made people that lived in the unincorporated county losers.
Yeah.
So
it sounds like we're all supporting.
So we're just trying to bring back a little balance to our community.
Well, so then I'd like to just read a couple of the sentence out of the Governor's Executive Order 20-12, Item 22. Individuals are directed to minimize travel other than essential travel or to or from a home, residence, or workplace for obtaining or providing food, shelter, essential consumer needs, education, healthcare, or emergency services, for essential business and government services, for the care of family members, household members, elderly persons, minors, or dependents. So, I mean, that's the governor's
So you're
travel
saying
ban
by
that we're under.
her extending her order July 6th, that's still in place?
Oh, no, so,
Right?
yeah,
Is that
because,
what you're
no,
saying?
let's get clear there, too, because the July 6th is just saying State of Oregon is under an emergency order. This is a different order that says this order limits this, this, and this under the emergency powers of this emergency order.
But don't you think that on the upper one, the deadlines on the upper one that were just.
The deadline is affecting it, yes.
Affects the
Yeah.
lower one of the, that you're pointing to.
But that's why, yeah, sometimes the headlines, because that really got people wound up when the governor extended the emergency orders.
Yes.
And what does that mean? That we're all on lockdown until July 6th? And it's like, no, that just means the system is in place till then.
Well, so we are really, by opening these up, we're going counter to what the governor has done.
But we're not advocating for, we're just, I mean, yeah, that's the interesting dynamic right now. And that's, I mean, the professional industry people need to just be able to answer that question, you know, I mean, if you're a tourism agency, property owner, you know, large property with many rooms, are we advertising or not advertising? Are we allowing people to travel or not? You know, and
I know they're not
acknowledging.
stopping them at the border. They're coming up from California. They're not stopping them, so. Yeah, no, we stayed in quite a few houses in Sun River before, and they're all very, you know, they're not
Oh,
like
yeah.
on top of each other. They're very roomy.
So then it's the dynamics of if somebody does show up, you know, making sure they're, you know, if the pool's not open and you know, you can go golfing in probably less density than in the past, or, you know, you get to.
That'll be the issue is that.
Is there
unless
amenities?
The governor reopens other things.
Yeah.
There'll be limited amount of things to do. I think, like in Sun River, I think the golf course will be open, is what I've heard, but.
There's lots of courses, and you can go horseback riding.
But I don't know that you can go to any of the stores. I don't know if you can go to any of the restaurants.
Yeah.
I don't think Sun River's open in their restaurant, or they're doing kind of a takeout system, so it's.
It's to go, isn't it?
Yeah. So, and, you know, as I say, the industry partners, let's figure this all out together, but we are still under the state orders. So then this, just like we spoke about a few minutes ago with this other order for the non-congregate shelter, the order for Deschutes County that we put in place is for 60 days also, and it was put in on the 13th of March. So is there, I mean, this kind of fits in that same scenario. Are we leaving it in place? Is there a decision space here? Dave, maybe you can help with that if you've thought about
Yes.
the order declaring a state of emergency in Deschutes County. Do we need to do anything with that in the next week or two?
Yeah, that would, I believe it was set for 60 days, so
Yeah.
we're getting within a week or two of that. Now, if you were to allow the short-term rental order to expire, I'm not sure in terms of any activity prohibitions, there'd be anything else necessarily, I guess, other than the events that are requiring some sort of distancing plan.
Yep.
But yeah, I would recommend that that be extended, if for nothing else, to keep the funding avenues open as far as wide as possible, and also to allow for some of the relaxed procedures associated with procurement and contracting in the context of an emergency.
So that'll be a discussion for next week, maybe if we get down to it, but just acknowledging that, yeah, we have a expiration date 60 days after March 13th. And this does authorize that emergency operations center, the whole system basically, you know, with Nathan Gareby kind of running the show or leading that operation. So my thought is, would we go, July 6th, because that's what the governor selected, or the rest of the summer or the year because we want to keep this contracting and financial opportunity going? Or, I don't even know how to get grounded in that. Or would we say, no, emergency's over in the short term?
Well, I resented the July 6th. Our country's, we celebrate July 4th. And if it's possible, I would like to have that celebration. I know that Frontier Days has been cut back, but they're doing their, fireworks on the 4th. So,
yeah. My own inclination would be if it runs out, or was it next week? Or
the 13th, I believe.
Is that what you said? To decide next Wednesday at our meeting, and I'm probably inclined to, if nothing's changed at the state level, to maybe extend it another 30 days. But if it kind of depends on what's going on at the state level, because they're so slow. Even last night on television, I heard this New York Times reporter complain that Oregon and New York were the two worst states at reopening plans. That was,
yes.
They were called out specifically, which on a national TV show is kind of unusual. And
Yes.
We got 50 states to work with.
Yes, our 140 ventilators that we sent to New York, we got a lot of press over that. And yes, what they were saying about us last night wasn't exactly quotable.
And we're one of the lowest in terms of testing that was done. But so I guess I'd be inclined to maybe a 30-day extension if we need it. But not, I don't.
Okay, let's do that. Let's do that next week. So can one of you make a motion then to make our intention clear that we are going to let the short-term order?
I think it's just verbal to let it expire. I don't know that we put a motion about.
Do we need a motion, Dave?
Legally, there's no requirement for a motion.
Okay.
That order 2017 will expire by operation on next Friday.
Okay.
So, yeah, my experience, as the chairperson, you just kind of make that statement, and we're all in the same spot. Yeah.
Okay, I would just like to make that statement that
There you go.
next week, it seems like the three of us are going to let the short-term order expire. So, anyway, if you were wondering, that's what we're doing. Eric, are you available for short special event permits?
Yes, I am, Commissioners.
Hi, Eric.
Hi. For the record, Eric Kropp, Deputy County Administrator. Each week, the board has asked for an update on special event permits. Just as a reminder, on April 15th, the board passed board order number 2020-023, which required any special event that requires a Deschutes County permit to have a social distancing plan for events occurring in April and May. To date, we have not had any events in April and May, so no social distancing plans have been submitted. In addition, I just wanted to update the board on upcoming events. Last week, there was lots of discussion about the Pacific Crest Sports Festival weekend, which occurs in Sun River. That event was scheduled for June 19th through 21st. And last Friday, the event organizer of Pacific Crest announced that they're taking their event virtually. So it'll be a virtual event, and they will not be seeking a permit through Deschutes County. That's the only change on the upcoming events. For Deschutes County events, there are now no events slated for June, and the next event on our calendar is July 4th for the Tumalo 4th of July parade. In addition, there are a couple of events that the City of La Pine permits that are listed on your sheet as well. That concludes my staff update.
Great. Thank you very much.
So July 4th is almost as far into the future as March 4th was back in the past. And on March 4th, we didn't know we had a COVID-19 crisis. I think our first case was maybe then. So is it possible that we would get to a point where there was no cases by July 4th and a parade in Tumalo would be fine?
Eric, what do you think?
Dr. Crow.
I'm hesitant to speculate on.
Well, please do.
Yeah, I don't know if there'll be cases in July. I really, it's more of a question for the public health folks.
We just wanted to be able to ride our horses in the parade. That's really because we signed up for the Sisters Rodeo already. Remember, we were so organized this year.
Serapis and everything.
Yes, we've got our Serapis.
Well, we basically have the 4th, and then there's the 11th, and there's 17th and 19th. So every weekend we've got stuff coming up in July, and so by next week we'll be 6 weeks away almost from July. I just wonder when. I know we hear a lot about this going on, but there's also a chance that maybe it won't be going on through the summer, and maybe we'll be able to do a lot of activities that we didn't think we were able to.
Is there a decision being proposed here today, or, I mean, it was determined last week that we wouldn't take the step to cancel or, revoke permits.
I guess we're just looking at it because we got another month coming up, and we actually did this agreement, or this deal we did April 15th. I don't know what you're asking.
Oh, so the social, is there a decision here?
I don't think so. But the Lapine Rodeo, that hasn't even been brought up then, has it? Have they said no?
Heard anything.
You have not heard? I have not either. Okay. I know, I was just thinking about that. So, but that's always with the 4th, is it not?
Oh, yeah.
So
Very
it's
much so.
all together. So, okay. Well, we'll have to see. I know, I believe St. Paul canceled, did they not? St. Paul and Molalla. So, all right.
I guess the decision that I was thinking we're making is, when are we going to, how far ahead of events are we going to be deciding things? Because the county fair is on our agenda too, coming up, and how many more weeks can we go before we decide that? Is it one more?
Can we
week,
wait
two?
till the end of, till 2 months ahead of time? Or is that too late? I mean, I'm sure it's going to have a different feel.
We're already closer than 2 months for the Tumalo Fair.
The county fair,
parade.
July?
Oh, but if you said the deadline should be 2 months ahead, we're less than 2 months ahead of the Tumalo Parade.
Oh, the Tumalo Parade. No, I was just thinking of the county fair. That's much huger. Like, I bet the Tumalo Parade, if the governor did change the rules and on June 15th or June, I bet they could still pull their parade off. Don't you think?
Yeah, it may be. I mean,
I don't know. How big of a parade is that, Eric? I haven't been to that one ever.
it says 300 people.
300? Okay.
According to the event, 300 is the estimated attendance.
But it might be a busy parade this year if it's the only one they held.
Yes.
We might all be there. Go on for miles.
Well, what kind of a,
The current board order goes through May 31st. So in a couple weeks, the question for the board will be to whether or not the board wants to extend the social distancing requirement plan submittal for events in June or July or July.
okay. All right. So we really should bring this back up then, the budget week, though, isn't the week before the 31st?
Budget week starts May 26th. So if the board likes, we could put this topic back on the calendar 2 weeks from today, which is May 20th.
Perfect.
And the week before Budget Committee.
That'd be great. Can you do that, Eric? Thank you.
Yes, be glad to.
Thanks.
So the next two items I've got, I think my papers are up in the office. I realized I didn't bring.
Okay,
Can I
so
get those, or
the next item is the whistleblower.
can we take a quick break?
Do you want to take a quick break? Okay, we just need to take a 5-minute quick break, please, unless Do you need yours, or does Tom have extras?
I want to get mine.
Okay. Okay.
Get the power.
Thank you. I don't know what I was thinking. I guess I got a little irritated there. No, I mean, I can't believe that. Yes, thank you, Stephanie. Well, we've re-adjourned. A little break there. Eric, I hope you're on. We're now talking about your whistleblower reporting policy.
Yes, I am, Commissioners.
Thank you so much, Eric.
Deputy County Administrator. Also joining me via Zoom, we have Chris Bell from Legal and David Gibbons, our Internal Auditor. For your review today is a whistleblower reporting policy, which is GA14. Just as background, we currently have a policy that's GA14 called Misconduct Reporting and Detection Policy. The current policy lays out the steps the county will take if there's a report of misconduct or what the policy calls similar irregularity. What we've done with the new draft plan or draft policy is we've incorporated the state requirements for whistleblower protection, and we also added in a hotline that employees would be able to call or email if they see that something isn't right at the county. And what the policy covers is reports of fraud, waste, abuse, or other misconduct listed in ORS 297.760. Last time we talked to the commissioners about the draft policy, there was lots of discussion about the term inefficiency, and the way we've proposed handling that is because inefficiency is a pretty subjective term. The new draft policy does not contain the term inefficiency, but it is still an element that can be reported to under the ORS. What the state of Oregon says is local governments do not need to have a hotline, but if they do, they have to accept reports of fraud, waste, abuse, and inefficiency. So we're proposing to take the term out of the policy, but it is still, the ORS is still referenced in the policy. And the reason why I have Chris Bell did a lot of work on the whistleblower portion of the policy, and Dave Gibbons was heavily involved with setting up or the discussion about the hotline and how that would work. That concludes my staff report. David or Chris, I don't know if you want to add anything at this point.
Dave?
I think we've talked about this to the board, I think a couple times ahead. I think I'd echo with Eric in saying that we addressed the verbiage, and it now uses a word called covered misconduct instead of inefficiency. So it's a much more broad term, and it refers to the ORS, so that makes it pretty easy. I think the other parts of the policy regarding the hotline are the same as they were before, but we're open to answering any questions you might have.
So I noticed the statement in here, whistleblower hotline. Did somebody go down the path of just using that Secretary of State phone number as our hotline? Can there be an agreement or arrangement in place, or is it appropriate or required to have our own?
The state has a whistleblower hotline, and anybody can use that hotline. What this does is this gives us more control over our own reports. If there were reports regarding Deschutes County that the state received, they would work with us, I believe. I've talked to them on a couple occasions. If they have things that they think maybe are in our jurisdiction. The same thing goes with this policy. If we get reports that, let's say from somebody who thinks it maybe is the county's issue, and it's really not the county's issue, we can forward those on to another entity. If that's the case, if it's the city of Bend or if it's the state, we have that ability too. So.
And just to clarify, the state doesn't require us to have a hotline. It's just something that we've seen as a best practice and a way to funnel in any reports.
Any other?
So this is the policy today, and the policy basically triggers the commitment to the hotline by signing this policy.
That's correct. If the board approves the policy, we'll move forward with setting up the hotline and getting out the marketing materials and information out to employees on how to access the hotline.
And is this a recommendation from the audit committee specifically, David Givens?
I believe we've talked to them on a number of occasions about this. This is pretty much best practice. Hotlines are what my colleagues are using, and they're tasked with working on to a great extent. So it's pretty much the norm out there. Jackson County has one, Washington County, Multnomah, City of Portland. I mean, all of my peer counties and entities are using hotlines.
Thank you.
And David, didn't you say that you expected a certain number of calls would be coming in on the hotline that would make it more accessible for people that wanted to make a complaint than current systems, or that was the advantage of it?
Yeah, I mean, hotlines are basically a great option for some people. Some people who want to make anonymous reports can do it that way. It's the hotline is not just a phone call line, even though that does get probably the most usage. They also usually have web access and other ways of receiving reports. The benchmark reports I look at and some of my peers that I've talked to, it's not unusual to have like, I think it's 10 reports per 1,000 employees. So we're expecting, anywhere between 10 to 14 reports a year based on what I'm hearing. I don't know what that will be in actuality since we're just opening something new up, but, and a lot of reports, I'll say one thing is, this provides an avenue for reports that might be the kind that we already deal with in our human resources department, grievances and things like those. Those bypass this and they'll go straight to HR so that they're handled in the like manner as they have always been handled. So,
will we get kind of annual reports on how many whistleblower reports came in, so we have an idea of how much it's being used and that sort of thing?
Correct. That's in the policy. Some level of reporting back to the audit committee and the board on activity, high level, what kinds of findings we're getting or what kinds of things we have to initiate. It's possible that, internal audits could be initiated from reports, in addition to, either investigative or criminal kinds of work. So we're not quite sure exactly what this will bring, but we're looking forward to it.
Good. Well, I think it's good if we have an open way for people to make their complaints, or you can certainly, we've seen a lot of whistleblower things on national events here in the last year or two, so I'm sure there'll be some local as well.
Yes, like significant stock sales before the pandemic occurred. Remember those issues that haven't really been addressed lately, where people saved or made millions? Yes. Okay.
At this point, I'll move approval, county administrator signature of the whistleblower reporting policy number GA-14, which will include a whistleblower hotline.
Is there a second to the motion?
I'll second that.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. Thank you, Eric. Thank you, Dave. Nice to see you.
Hey, thank you.
And also thank you to Chris Bell. He also did quite a bit of work in addition to.
Oh, yes, Chris.
Yeah.
Thank you for all your work. Okay. So now, Laura.
To discuss the spay and neuter grant program the county typically provides each year, which has been available to local nonprofit organizations that provide spay and neuter services to in Deschutes County for feral animals and pets whose owners can't afford or access those services. So in the past, the amount made available has been a combination of the dog license donation program and then supplemented with general funds to make the total amount awarded about $13,000. And the solicitation is typically run for a few weeks during the month of May. And you have the draft application in your materials today. So currently available funds from that donation program are $4,328. And we are seeking direction on whether the board would like to proceed with this year's solicitation, and if so, how much you would like to offer.
I remember Commissioner DeBone said last year, I think he was, our supplement might have been an issue. Can you remember that when you were talking about? Yeah, because I was thinking like, well, this is a good idea. There are people in our community. And, right now, honestly, pets are really important to a lot of people. Having that loving pet that's so happy to see you. So what kind of funding is available for this year? Do you have a number for us? Because I see the average has been $7,800.
Yes, currently available is $4,328. So if you wanted to make...
But I meant to add the additional funding.
Yes. So
General
if you wanted the
fund
total
makeup.
award amount to be $13,000, it would be a transfer of $8,671.
Okay. All right.
Well, so I agree that pets are important, but I also believe that our revenues are going to be down some. Maybe we should authorize a little less. And so I propose 6,000. That's what we're being asked, right? We're
Correct.
being asked how much we take from general fund.
Right.
A question, if I might, Commissioners, for Laura. Unlike, what the child care, the one that we dealt with earlier today, didn't we budget for a transfer in from the general fund for this program as part of the approved FY20 budget?
I would have thought we would have.
Since we do it
You're
every
the
year.
budget officer. Yeah, you tell us.
Yeah, what did we budget, Tom?
How many line items do you need to
slacking.
remember?
Don't you have a number somewhere that we budgeted? Because honestly, things have changed, and if we did budget, maybe that's where I remember the conversation from. I do remember a
Do you
conversation.
think it was lottery funds or something like that, or?
No, I think it was general fund. I think we've used general fund each year, but since we build the spay and neuter grant program and the use of the those donations each year, I seem to remember that we had a proposed number in the budget for this, but I could be mistaken. Do you recall, Laura?
I don't, but I'm happy to look that up and can get back to you.
We might just balance it up to an even $10,000, so it'd be 5,000 something.
That's what I was thinking.
Because then the total
We've
on
cut
the
it back quite a bit.
introductory letter would still look good with the 10,000 number.
Right.
So that would be $5,671.
That's what I was thinking.
So, okay. So that is cutting it back. Commissioner Henderson, what are your feelings? I know you said 6,000. It's a couple hundred different.
So if we give less, then what's that mean? Less people can get spay and neuter for free, or basically?
Yes, so with last year's funding, there were about an additional 334 surgeries performed. So I would assume that would be decreased a little bit.
This transfer actually goes to the humane societies, is that right? It's not for individuals to apply to have their own pet. Yeah.
That's correct. Yeah.
Does any of it go to Brightside?
I believe we have funded them in the years, a couple of years ago, not last year.
We didn't?
Or in
'Cause
2018.
Oh, okay, because I was
No.
thinking, we talked to them and said, please get your application in, because I'm sure they could use the funding.
Yeah, I don't believe they applied last year.
But they could apply this year.
Yeah.
We just need to remind them. Okay.
Yes, so the solicitation is not open currently. So if, with the board's approval, I would, have that $10,000 amount available. We would draft a press release and then have the application available online.
Okay. Do I need a motion from someone then?
I move to make the fund $10,000, augmenting it with general fund dollars.
Okay. Is there a second? Okay. The chair will second it then? Any further, or was that a second? No. Okay. Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
I guess I'll vote yes. I feel like we should give a little more, but.
Okay, the chair votes yes.
Thank you.
Thank you.
Okay, so now we need to wait for Sharon to come down to go in, unless there's any other further business that we need to discuss at this time.
Commissioners, I was just going to give you a quick update. Whitney's made one round of revisions based on to the reopening plan based on our discussion this morning. I've edited those and given her back some more. She's working feverishly on them right now, but she suggested that we do go ahead with the executive session, and by the time that's done, she ought to be ready with an updated reopening plan for you to take a look at, assuming you want to try and get it done today.
Yeah.
Good.
That'd be good. I got a couple of other items under the other items thing.
Oh, sure.
So, one, I felt a little uncomfortable in the meeting talking about this, but I'm a little bit unclear, Tom, maybe you have a perspective on why the city would come to us wanting money when they haven't committed it themselves. And this whole thing for the child care really had come from them. It's like, well, I don't understand why they were saying it's easier for us to give the money than them. I mean, don't they just vote on it like we do and a check gets written to EOC for this? I mean, I just don't get that. I didn't want to really say it, but it just seems odd to me.
I don't disagree with you on that point. This actually came to me through Nathan. So they went to the EOC and Nathan first before it got to me, and I had a whole series of questions different from the ones today, but I agree with you that they ought to be able to. I don't know, I'm not familiar with the city's financial processes, but I would have thought that they would have been able to authorize an immediate disbursement, just like you can, of their funds. My understanding was that they were, they were hopeful that they could make their match, their reimbursement out of CARES Act money.
I know, but we'd like that too, but it's.
Yeah.
Well, I mean, was supportive of what they were here for. I just don't quite get the dynamics. And then it was repeated that, well, because it's the EOC, it'll be easier for you. And it's like, we do the same thing they do. We would transfer funds. So I don't know.
And again, I didn't quite understand that either. So I'm not going to try and interpret what we heard from Carolyn, who's not the city manager or the finance director, and their ability to quickly disperse funds.
Second thing I had was I mentioned I was at the Ready meeting this morning, and it was brought up again about funding, and where are we going to be, and because they're worried about their own funding because EDCO's been cut, and Roger had been here right before this kind of all happened about their budget, but I think that is going to be something we're really going to have to think about, how we're giving money to those entities, because a lot of them have been dependent on us, and Ready's example of that. They're still seeing lots of business, but they're aware that business is being hurt, and business getting is being hurt by things being shut down, so it just made me think about it because I'd been on a deal. The other idea I'd had, which is something we could talk about at another time, but I'm wondering with regard to helping businesses, one of the things we do is we charge for the environmental inspections at restaurants. I was wondering, if it's valid to help childcare continue, is there some way we could do a reduced rate or no rate for inspections for a period of time to get restaurants back up? Because I guess we're not doing them currently or something for our health department.
Variation with kind of phone check-ins with restaurants.
Yeah, but not the real in-person. But I just thought as an idea that might be something to think about in terms of helping sectors. That's one we have a direct interaction with. So
you're thinking general fund?
Yeah,
support to environmental health, just offset those dollars?
Yeah, or something like that, possibly.
It's going to be so hard for those restaurants to come back, and especially with the limited amount of patrons, that they could have, definitely. And we want them to come back.
If they all come back at just half or something, that I'm not sure how many do well at half. But yeah, I get it.
Right.
Just an idea I thought I'd throw out today before we get to.
No, that's,
we don't know when they get reopened, but
it's an excellent idea.
As commissioners, as you know, you already subsidize restaurant licenses through the general fund to keep the rates low. And it is going to be a budget issue again this year that we'll talk about during budget hearing week, the level of subsidy. Unless they've changed it, restaurant license fees are due once a year, and I think it's in December when the bills go out to all existing restaurants. If there's a new one, they pay up front. So I don't know that it's an immediate fee that they'd have to pay during the reopening, but we'll be having that discussion anyway in terms of the level of subsidy like for restaurant fees.
I thought maybe they all had annual inspections. Their payday was, they have a June opening, June inspection day they pay, and in July, and yeah.
That's what I would think, that they would all have their own date, wouldn't they? We'll have to find out.
Well, yeah, it used to be when I oversaw environmental health and CDD, it was once a year, December, but it could have changed.
Okay.
That's a great idea. Whatever we can do, because it's going to be, there's a lot of people that aren't working because of it, and their income is definitely cut back, and the funds they need in order to open up are huge. So, all right. So, any other?
No, that's all my other items.
Okay. So therefore, we need to adjourn with our regular session of Deschutes County Board of Commissioners, and we will reopen in an executive session.
Now? Okay.
Okay, we are now reconvening as Deschutes County Board of Commissioners on May 6, 2020. Our team has been working so diligently this afternoon, and we get to look at our plan again. Thank you. Thank you, Whitney. Thank you, Tom.
Gracias.
Look at this. Oh my, and it's on one page. Fabulous. Oh, now we're up to 81 instead of 80? Okay.
Awesome. What a great cover letter.
Yes, it
Got in the high unemployment. Yeah, good.
So I did take the draft watermark off of that version in case we wanted to
Sign it?
The board wanted to sign that today.
Yeah.
Oh,
But
thank
also,
you.
I'm happy to make any additions or modifications that might be helpful.
So do you want to just walk us through the changes?
In the plan?
Yes,
Yeah.
please.
Do you want
Okay.
to drive on that, or, okay. So what I did in the version that you have in front of you is highlighted sections that have changed. Track changes in this current document are a little bit complex, so I think the highlighting was the most straightforward place to go. So the first update begins on page 3. That is just a current snapshot of where we are in terms of case count and testing. So that's, and it includes the date so that it gives a point in time reference as the board discussed this morning. Below that is an updated chart from Jenny Faith at Health Services that shows kind of our cumulative case count to date. So that has been updated as well.
Oh, it's awesome. We can just track it right down.
And the charts on page 5.
Charts are awesome.
Much
Okay,
much
so
better.
Jenny recreated those, and that takes out the,
Future.
yes.
Yeah, that's nice.
That makes a lot more sense.
So yes, special thank you to her because she kind of dropped everything and generated all of this, so that's awesome.
We will thank her.
Yes, page 6, we've reflected under robust testing and case investigation and contact tracing, the 600 tests per week that has been updated. Additionally, I added the Summit Medical Group testing capacity that they mentioned during the update to the board this morning.
I think that's great.
That is also reflected in the table on page 7. You see that additional highlight, so it's a little bit of a dual mention that calls out that expanded testing. On page 8, under contact tracing, that updated section, I think, reflects what I heard the board say this morning in terms of how we have been working to meet contact tracing needs locally and how we would respond to any potential surge, but we wanted to make sure that that is accurate and reflects the board's intent from this morning's conversation.
Excellent.
Yeah, it reads good.
Yes. And the last thing was utilize state resources, which is right where it should be. Yes.
But
I was just going to say that paragraph that isn't highlighted just below that also, we had, that gets at the two other elements of that prerequisite in terms of bilingual capacity and 95% that we had neglect. It was in Health's matrix that they sent you yesterday, but we inadvertently left it off in the draft we did. So this puts it back and I think now fully addresses that prerequisite.
Okay.
On page, let me see, okay, page 12. This is the section that speaks to healthcare capacity. And at Tom's suggestion, pulled over that highlighted paragraph. Those 3 paragraphs come from the response that St. Charles provided, and then also we pulled in the data that they submitted as a response to our initial draft that was sent over on Friday. We also reference in that section, in the table, we reference the attached response from St. Charles that certifies healthcare capacity which is the attachment that you have up with you in, as part of this packet, which is that formal letter from St. Charles. And then the next edition comes on page 16 under business sector considerations. And that was the attempt to provide context to what that section speaks to. And Commissioner Henderson had provided that feedback that we could frame up that as the state has been releasing draft guidelines, we've been working with our cities, chambers of commerce, EDCO, to gain feedback from local business owners on what the impacts of those draft guidelines will be for those industries.
I don't know if I want to change anything, but we could say on how draft guidelines will impact and be implemented by local businesses. But then we can't sign it right now.
But we're gonna have to do a new printed version without the yellow highlights.
Yes.
Oh.
Draft is still on this.
Oh, okay.
It says
okay.
draft across.
Well, I thought you said you had one that didn't have. So how about will impact and be implemented
That's
by?
one of the letters, right?
Cover letter
Does
is
that make
not
sense?
one.
My cover letter doesn't say draft. I can sign it. I'll forge everyone else's.
Yes, I will make that update. And then we also provided some context and background on page 17 with respect to the tourism and outdoor recreation industries. And hopefully I captured your edits
Yeah, that just
appropriately.
acknowledges that we've also got draft guidelines from the state on the outdoor recreation industry, and that we'll work with that industry as we are with the service sector businesses to, with whatever the final version is.
And then at the
Oh, thank you for the paragraph one.
Yeah, the top of page 18 is the paragraph on faith-based organizations, and then an update under the request to reopen local businesses. So I'll give the board time to digest that language and see if we captured your intent accurately there.
So, I know there's a variety of faith-based organizations, but the vast majority of them in our county are probably churches. So, it really, so I wouldn't mind putting both. We've heard from a number of church leaders. I don't know what the other people, what you all think, but churches and faith-based organizations.
Well, yes.
Like we need another sentence beyond the anxiety, depression, loneliness. It's not just we need it because it's a recession, we need it because it's part of our lives. I mean, it's part of our, seems we need something, we don't just need them open because it's bad times, we need them open because they have a right to be open, they're part of lots of people's lives, as just as much as going to restaurants is, or.
Well, and I like the statement foundational element in our communities. So I understand what you're saying. It is stated in one fashion. I mean, it could be stated other ways.
I feel like we need one more sentence in there, yeah.
Well, and that's fine. I think the thoughts are complete, but if you want to add a sentence, that's fine also.
We don't just need them to be a way to support each other. It's, see what I'm saying? We're just emphasizing that why we need it for hard times. Like, well, since the war is on, we need to open the churches. It's more like, since churches have a right to exist and churches are part of our life, they should be open too. I don't know how to say that.
Our country was formed on religious freedom, and it's a basic tenet.
Yeah, huge.
Yeah, I mean, that's fine. Use religious freedom in a sentence.
Well, you could say that. You could say religious freedom has been a fundamental tenet of Americans' constitutional rights.
Or we could
Bill
say
of
we've had
Rights.
input from our, folks saying they're ready to take on the challenge and be, I guess, provide social distancing and the reasonable regulations or whatever.
You could say churches and other places of worship are a foundational element in our communities at all times.
Yes.
And if open, would provide a way for people to support each other during the current
There you go.
pandemic or during the current whatever.
Well, I like that also, but I think we should have one in between there that says religious freedom. We know that many residents are struggling with anxiety. In addition, religious freedom is a core tenet of. How about religious freedom and practice is a core tenet of American life, the American Constitution.
America.
Of America.
Yeah, for in practice. Religious freedom and practice is a core tenet of America.
Whitney, in the third paragraph, you have state capitalized. Do you want that in the summer state restrictions? Do you want state?
We can go.
I didn't know.
Probably mildly inconsistent throughout this document, but we can make sure that we choose one and stick with it appropriately.
Okay, all right.
How about, okay, we believe it is important that faith-based organizations be allowed to open now, as opposed to as soon as possible.
Yes.
Okay.
What do you guys think of that?
I sent an email to the governor's office today, and that's what I said. I said, really, we need to open it now. It should never have been closed.
Religious freedom practice is a core tenet of America.
Why was Lowe's open?
Yeah. Well,
And Ace.
How about the liquor stores?
Yes.
Yeah.
Well, then we would have had a protest
Yeah.
immediately.
Religious freedom and practice is a core tenet of America. Churches and other places of worship are a foundational element of our communities at all times, and if opened, would provide a way for people to support each other. That broadens it out some. We made it urgent. We gave it a bigger, tied it into America. And we said it's all times and in bad times.
Okay.
Is that good enough?
I think
guys?
it's good. I'm great we added that paragraph, don't you think?
Mm-hmm.
Very much so. I can check with you on the wording if you want, Whitney, unless you got it.
Yeah,
Okay.
what you said is
Okay.
in the current draft. So this last section on reopening local business, I think reflects the conversation the board had earlier, but just wanting to double check that captures your intent.
Is our unemployment still 12.4? What did Damon say today? Did you get a number, Phil?
Well, he doesn't have any new numbers till tomorrow.
Okay.
Because, it's, today he was just talking about what he thinks might happen, but he just had last week's numbers at 370, whatever that is.
Okay.
We're using 12.4 as of now.
Yeah,
Yes.
and if that moves.
No, yeah. So, will I come and get the document then in the morning?
Well, what happened to the stuff about, it's in the first paragraph now, I see.
Yes, it's up in the first.
Given the above, we propose that all local businesses do good job, yeah.
So
I thought I should drive over with flags on all sides. Do we have a Deschutes County flag I could have out my, do we? Nope. No.
you probably need.
Okay, and where it says that non-essential travel should limit that travel this year, until the emergency order is lifted or something? Or, I mean, we don't want it to limit travel in September, do we? October, November, December?
No.
So maybe it's not this year. Maybe that should be something more.
Should limit that travel until the emergency order is lifted.
Does that sound reasonable?
That's better. Yes.
Right now, that's July 6th or something, but. The next sentence is, this will allow local businesses to reopen without as much demand as they might have. Okay. As a community, I'm not sure that that's what businesses want us to be saying, but. You will have and you will continue. But there are residents that will be glad that we do the slower opening, I'm sure, to see if there's a ramp up in coronavirus in the meantime.
Mm-hmm. Well, I heard on that particular sentence, as part of what Kevany has shared with Visit Bend, that they kind of view, as opposed to having different phases related to businesses, that the lifting of the county's short-term rental ban will be kind of phase one of allowing people to get out, at least locals, to enjoy the outdoors more, and that then the presumed eventual lifting of the governor's order would be kind of the second phase, that there's sort of that little bit, not intended necessarily as such, but there will be sort of naturally a little bit of a ramp up in patronage for outdoor recreation to enable them to sort of gain experience with the guidelines and the restrictions and be safer for their employees, build faith with their customer base that they're doing things properly.
So we'll put that in until the emergency order is lifted.
Yes, I made that change.
Then the next one is say, we believe is critical for our county's economic stability. How about stability and prosperity? That we reopen for business as soon as possible. I mean, we really want to be prosperous. We don't want to just stay. Are you guys all right with that?
Mm-hmm. That's a great ad. And I like that. Thank you for approving this plan for our community.
That was actually your sentence from a week ago, so I'm glad that you.
Really?
Man, that looks good. Yeah.
No, it's like
good to put that in. No.
Positive, right?
Yeah.
It was very positive.
Yes.
The one
Like, thank you for choosing us to do this job. Good.
So there was just, oh, go ahead.
Well, originally we had talked about having a signature block as part of the plan. Would you still like that for you to sign the plan in addition to the cover?
Well, there is, yeah, I would. What do you think?
Yes.
And what about George as the health officer?
I mean, yeah, an official page, if we could get the health officer and hospital CEO to sign too. I mean, that was kind of the vision when we started.
Well, the hospital are on their letter, which you've attached.
And that'd be the most impactful if we got to that point.
Okay.
I don't know if you can get his signature today, but maybe you can.
Maybe I can drive back in the morning.
Do George's electronically, probably, if you want.
Oh, okay.
Yeah.
And get the three of you to sign it in a few minutes.
Okay.
Well, we charge extra after 4:30, so you better.
Uh-huh.
Well, with that in mind.
Oh.
Well, we saved a little money on another program today. We have where to reach.
We've got a little money left.
Yeah, go ahead.
Commissioners, really quickly, and I think Dave Doyle is still on the line. You might remember that when we were looking at the draft criteria that came from the state prior to Friday, there was one of the elements was that the board needed to have a vote certifying that the county had appropriate PPE for first responders. That was kind of the action item for the board. And Dave is up on the screen. He, I think, can speak to this, but there's a little bit of discussion, I think, about whether or not that vote needs to take place, and he's prepared a draft order that's in front of you that would allow you to do that. But Dave, I'll turn it over to you to explain that more eloquently.
Yeah, that issue has been bouncing around at the county council group statewide, and we were discussing it again today during our weekly conference call. And about most of the counties that are moving forward or have moved forward with plans have gone ahead and done a order or resolution certifying the PPE because it's just not clear if the subsequent 7-step criteria process mooted or voided the previous requirement to certify PPE. So it's really just a matter of whether you're comfortable doing that in addition to your reopening plan.
So do we know what number it would be, Sharon?
It would be 2020-026.
So the crux of this is confirming that we're confident that we have personal protective equipment at the first responder level. Is that what it is?
Yeah, that's what it is. A lot of what's driving this, I think, is there's some real concern that the governor is starting to look at ways now to shift some liability to local governments. And so I don't know if it's paranoia at the county council level or if it's just being extremely prudent, but a number of county councils, including, I believe, yesterday, Lane County, have gone ahead and done the certification piece so as not to open up an opportunity to say, well, this plan you submitted doesn't include a certification and therefore we're not going to consider it, or we're going to put it on the bottom of the pile, or something of that nature. So that's what's driving it. I don't know all the politics and games that might be being played. I don't see any downside to certifying it. We, put a lot of kind of soft language in there, essentially saying we're certifying as of now that we believe we have enough PPE. Things could change, and we reserve the right to tell you something different.
Good.
Well, I think this is consistent with what Nathan's told us, and that's what it says, the governing body, Deschutes County, that we're certifying that the county staff has made inquiry to Deschutes County first responders and made a good faith belief. I mean, he gave us the spreadsheet 2 weeks ago, and it seems like he verified it today. I mean, we could ask him again if we need to, but we're not saying we know if we have it. We're saying we've asked the staff.
Mm-hmm. Yep.
So, doesn't matter to me. I'm whatever we want to do.
I know we have a lot of extra masks, so definitely I could sign it.
Good. Well, so order number 2020-26, is that correct? I'll move approval in the matter of approval of a certification of sufficient PPE for first responders and delegating authority to the county administrator to sign any certification.
I'll second.
Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yes.
And the chair votes yes. So thank you, Dave, for preparing this.
Is there another vote on the plan itself? Is that the idea? Yeah.
Okay.
I'd move approval of our reopening plan as amended with a few extra words here just now, but as shown to us, and recommend a full endorsement of this board.
I second that, enthusiastically support. I want to thank the staff for getting this going this quick.
Any other discussion?
No, just great job getting it finished. It seems like it came together a lot better at the end than it looked like it did for the first 2 weeks, but it's great.
Well, and I'll acknowledge, I mean, it already, it feels better having this kind of finalized, reaching out to the hospital and having a response, working with our health department and kind of the analysis of the numbers, emergency operations folks getting the spreadsheet of PPE back to us. There's been a lot of moving parts on this, bringing it all together, putting it on paper, getting it out the door, driven down with red, white, and blue American flags flapping in the back of your pickup. It is very positive at this point.
And I want to thank God for 80 being what's on the document. Thank you. 80 is, that's a good number. So, you know, we do have 197,000 people, and I know, Whitney, you're going to really go to sleep really well tonight, I hope, because you have put your heart and your soul into this, and Tom, and all the work you guys have done. So I thank you so much. Commissioner DeBonne?
You made the motion.
Oh, you did, didn't you? Commissioner
I vote
Henderson?
yes. I vote
Okay.
yes.
Commissioner DeBonne?
Yes.
And the chair votes enthusiastically yes. Isn't that what you said we're supposed to do? So, yes, enthusiastically. No, thank you, truly, for all your hard work. So, any further
There'll be a
business?
signature block on so yeah, we'll stay for signatures if.
Okay, therefore, our meeting is now adjourned.